Good morning, ladies and gentlemen. Welcome to a new day of the 4th edition of the World Health Congress Prague. As we open this Congress Day, it is my honor to introduce Professor Gejza Timcak, distinguished academic, President of the Slovak Yoga Association, honorary member of the European Union of Yoga, and internationally recognized scholar and teacher who has devoted decades to advancing the practice and science of yoga. Please welcome, the floor is yours.
Okay. So, ladies and gentlemen, being the first, I hope you are already awakened to the day which is ahead of us. And I had the privilege to present you something which was presented in various contexts, but not actually alone, because, you know, it is a difference whether you take yoga as a side auxiliary help for people of oncological problems and so on, or you have to adapt yourself to a regular practice in a hope for a better life. Why? Because like in every system, the aim is that you end up in a better position, and better position means that your life would be more energetic, your energies will flow in the right direction so that you do not create yourself more trouble than happiness. And so, since 1975, we have an organization which is, in fact, a local organization. You know, Slovakia used to be a part of Czechoslovakia. Czechoslovakia used to be a part of the monarchy. And so, we are all, in a way, members of a bigger community. But this organization is a local one. And we cater mainly for the local people. When I say cater, that means we are serving them. And when we look at the portfolio, then this number of people may look, in comparison with the others, who within a couple of weeks reach 80,000 people. But these are the people who are attending year-long courses, intensive one-week-long courses, so they are able to shape their life seemingly seamlessly. But we will see what are the obstacles. So when we saw that it is not so easy for a European person to align to a culture and technique which is originating in India, which is relatively far, even though it has been mentioned that we are supposed to be Indo-Europeans, but India is still a little bit far apart. So then, when we have been during a very hot period of the climate in India with a colleague of mine, Ivo Sedlacek, in an ashram, and it was impossible to do anything because it was so hot, so we were just lying, and then we came into an idea, because he is a musician, that, well, if we would be able to offer something which combines live music, not from the notes, but from inspiration, then perhaps it would be easier for the people to keep to the actual essence of yoga, because the music takes away many of your thinking processes. So this is how, in the ashram of Mahasiddhartha, we came upon this idea, and it is something which I will touch later on. So this is one of the aims, how to reach this state, the basic state of satisfaction, which is santosh, and how to come to something which we call ananda, and it's a nice word, but it's very difficult really to merge into this state. Now, you see, this is a typical setup. This is a summer course where you have all age represented, from kids, they have special program, to elderly. This is Ivo Sedlacek here on the left. He doesn't like being photographed, he always shies away. Now, when we have discovered this possibility, then through the European Union of Yoga, it became evident that there is quite a need for such a teaching, which doesn't really get lost in the theory, but supports the process through really very inspiring music. And the mentioned Ivo Sedlacek is really a lucky person, because his son doesn't go away from him, but they play music together. So we publish a lot of works, and you see this is again an old black and white remembering of a yoga course. This is a newer one. It's always at a place where we are away from the main line of civilization. And so when we analyzed why is it that so many people who came to the courses are still having problem of regular practice, and they cannot really well integrate. Yes? No, tak tu už je priepasť, ale môžem to skúsiť. So, even though we know that yoga is known since the times of Alexander the Great, he was the first known importer of yoga, even though some people, they say it comes even earlier. Then we had Ibn Battuta, who was an Arabic traveler, who actually said that in India, two types of people are really honored. One is the physicians, the Ayurvedic people, and the yogis. So then comes the Jesuits. In the 14th and 15th century, they brought all the information about yoga, but unfortunately, at that time, the atmosphere, the cultural atmosphere, was not really conducive to that. And then, in the 19th century and the early 20th century, a new infusion came. So you perhaps know that there was this World Conference on Religions in the United States, and people like Swami Vivekananda, who was a disciple of Ramakrishna. So they started a new wave of what they hoped would be an understanding what yoga stands for, what Indian philosophy stands for, how it can help to have a fruitful life. Now, this is Vivekananda. Not everyone knows that he was also a Freemason. Yeah. So, what are the programs? You know, if you listen to the various presentation of the Ayurvedic physicians and researchers, you see some of that. So Shatkarmas, which means it seems to be just a cleansing process, but basically it cleans the system of energy. That means, for example, Granta Samhita, so Rishi Geranta is telling about the importance of the Shatkarmas, not only by enumerating that, but he says that unless your system is purified enough, your mind cannot be calmed and cannot be really made to just rest, because there are so many discordant information in your system that they always pop up and keep you thinking, doing, forgetting. You know, so many people say, I try to meditate, but when I sit down to meditate, suddenly there is thought comes. Oh, I forgot this. Oh, I forgot to call that person. Oh, yes, I shouldn't forget this. So meditation is, in fact, a sort of remembering of what we hadn't done or what we should do. That means that's not a meditation. So it is just a type of planning of the day. So the asanas help to stabilize. Then relaxation, yoga nidra, and yoga nidra again helps. But, you know, yoga nidra and relaxation is liked very much because you just lie down and the teacher is working. You just lie down. If you have to do it yourself, so you have to remember, first of all, it's not a complete relaxation, but it's so easier when we are in a group, practice in a group, because we have the atmosphere, yes. But if you do it once a week, it's nice, but doesn't really work 100%. So the Savita Yoga, I will return to that, but our aim was to really do not dilute the program, because there are some tendencies that we dilute the yoga program, and therefore it's easier to accept, yes. But then if you dilute it, I wouldn't say that homeopathy would not work in this case. So if you do just practices in a homeopathic way, that, for example, in the morning you wake up and for 1 second you remember, yes, I should practice, but then you go on. In this case, you have really to be allopathic to the sense that you have to do the practices. So meditation, already mentioned, and workshops where you learn also the background. So what is the framework within which I can have a successful yoga practice? So this is with the violin, it is the father, and the handpan is his son. So this is actually a style which, if you would experience, you would know how difficult it is to describe it. So I just say that this is a music which is actually being formed on the spot. And he wanted to have some colleague musicians to accompany him. And said, okay, where are the notes? There are no notes. Okay, I can't do that. So this is the difficulty of it. You have to have inspiration. And he, of course, he is also doing yoga. So what to do? So first of all, whether it is yoga or not, you have to frame your lifestyle into some form which is conducive to one thing, that you do not take more burden on you, but you start unburdening you. What do you mean? You know yourself, how many times it happened to you that you know that you should do this or that, but suddenly realize, no, not this time, not today, tomorrow. And so this is something which holds us back. And it holds us back because we have a lot of burden in our mind which prefers other activities than the ones which would be unburden our system. So the Bhagavad Gita is also telling that unless our internal information system doesn't allow us to understand what it is about and be in agreement with it, we will not be able to do it, and we will be pressed to do things to which our mind and the internal structure and databases are forcing us to do. So how to ease that? Well, again, effort. But the effort is the better end of it, that we start with these recommendations. But they're not easy. Just try to imagine ahimsa, not hurting anyone. But can you do it? Can you foresee that if I tell someone something, how the person will react to it? You know, if you have a kid and you say, oh, I do not want to discipline it, well, life will discipline him or her. Then you see that he has a problem of adaptation because he didn't learn certain things which only the parent can actually teach in an early age. So harming and not harming is a great question. Or satya, tell the truth. Okay, but the truth can be a sword. It can hurt the person. So how to do it in such a way that it actually helps the person to transform? So they are not easy concepts. And so there is a lot of obstacles mentioned, and these obstacles are the same in all culture. So Ponticus Evagrius was a Christian monk who actually was speaking about this, that these are the gluttony, lust, greed, and so on and so on. But if you are gloomy, it may be worse than if you do something which is actually incorrect, because you keep up your mind in a state which is non-conductive to positive actions. So, Svadhyaya, Gabor Beck was yesterday speaking about it in his presentation, so I will not deal with that. But when we say that, what is Santosha? So you may know that one of the lead authorities of the classical yoga is Patanjali. And when he speaks about Santosha, which means a sort of inner peace, joy, and preparedness to act from the position of harmony, whatever it may mean at the given point, then you are in a very nice, exalted position. But didn't it happen to you that you wake up, you're fine, suddenly you meet someone who is just pushing you or doesn't do what you would like to do, and all your Santosha is gone. You think, oh, this is an unkind person. So how to manage it? Well, there are two ways. One way is, again, Ponticus Evagrius says, well, if I'm satisfied with what I already have, all my wishes are satisfied. But it's difficult, because what do I have? Is it enough? You know, if you visited Temu Comp and you will see what you can buy, suddenly you see, oh, I need this, I need this, I need that. These are the real issues of life. So we can read very inspiring lines, but how really to implement it in our life, this is really a big question. And so, even though the yama and niyama are very important, but even understanding what does it mean in my real life, when do I hurt someone, or when I do, which is my real need, or when I am actually accumulating things at home which are not important, it may seem, well, perhaps this is not the goal of yoga. No, it is just cleaning the ground so that actually one is prepared for being willing to enter a little bit more intense covering of the challenges of life. Now, what is the challenge of life? You know, we have been hearing that patients lose motivations. Because if you know you are an oncological patient, the physician tells you, oh, 3 weeks, maybe 1 month, yes, then can you be optimistic? How many people say, no problem, just let me go, and I will come back. New body, new possibility. No, this doesn't usually help. Even people who say, yes, I will pass away without problem, when it comes through, oh, I didn't do that, I missed that. So the attachment is always there. How to deal with that? Is it legal? Illegal? Of course, it is human. So only if we have an inner secure base on which you can be sure that whatever life brings, you do whatever you best can, and then you have to accept the consequences. And if you do it, then you are internally satisfied to the degree that, okay, it may happen that all the things which are happening to me have a deeper meaning, and I have to deal with them in the sense that I seek what actually it means for my life and actually path of life. But again, one of the key issues in yoga is meditation. Why? Because the meditation, first of all, cleans all the databases and their activities which flood our attention and bring it before us. So this is a graph which is actually was published first in 1972 by Tomito Hirai, who was doing a very extensive research on Zen meditators. So if you are going deep enough in meditation, but you are not well trained, you fall asleep. Is it good or bad? Well, it's good, but because if you cannot fall asleep, it's not good. But actually, if you are a trained meditator, then you can actually stay awake, that means conscious, even when the state of mind, using the EEG terminology, a delta dominant state is there. Delta is a very slow, 0.1 up to 4 hertz. So if you try, you see, it's not possible without proper training. And if you are there, there is one more mystery, which yoga tells you, that, yoga describes the human structure in a way that they speak about koshas. And these koshas are, one of them, the last one, is the Anandamaya kosha. You say, oh, Ananda, that's what I want. Yes, but it's not so easy. But we don't have the time to deal with that. But one thing is very important, that during your dreamless sleep, that means that you have no dream. If you are waken up, you don't know where you are, who you are, why are you there. This is the state when the Anandamaya kosha suddenly opens up a gate, so to say, and you are immersed in this Ananda. And that means not only Ananda, but also a different state of being. But the moment you wake up, you don't know about it. So the mystery of yoga, how to make it conscious. And this is the key. So the next question is, okay, who is the one who actually experiences everything? I see you, you see me, and we feel that's okay. This is how it should be. But there is a concept which is called ahamkar. Sometimes, not very fortunately, they translate it ego. But ego is already a qualifying expression. Big ego, small ego, aggressive ego, and so on. But the ahamkar means this is the perception that you are. Aham, I am. Where to find it? Well, every one of us, it carries. Otherwise, life would have no meaning. And this is what Gabor was about, that the AI cannot have a consciousness which actually works on this vertical way. So, the Karmakala Vilasa, which is an old text, says actually on the absolute level, this ahamkara is a universal process. From age to the last sound of the Sanskrit ABC is included. So the moment the actual universe starts appearing from A to Z, that's the universal ahamkara. Without it, there is nothing to see, because there is nothing manifested. So, what is the actual state of mind, or state of being, to be more accurate, which we seek during yoga? And why do we do that? You see, there is a concept which is on a slide after. It is called the Ritambhara. It is mentioned by Patanjali, again in Patanjali Yoga Sutras, but many times people do not pay much attention to it. Why? Because, okay, Rita is to write the order and so on, so something like that. But Ritambhara is something which sometimes you feel the flow, but the flow of a different type, which means that if you switch off by yoga practice, meditation, sometimes happen just spontaneously, you switch off all these functions which bring to you your thoughts, memories, traumas, happinesses, whatever, then suddenly what comes through you is this information about the fullness of life. That means how life should look like. Then it's not you who is actually following this decision-making process. I do this or I don't do this. First of all, who is this I? You know, once Michael James, he was an interpreter of the teachings of Ramana Maharshi, and once he was asked a question, you are explaining the teachings of Ramana Maharshi so nicely. So, did you actually realize the aim? And he started just, and they said, no, I still see people as persons. So this is it. So the moment the Ritambhara is providing you, thank you, with all the information you need, then it's not you. So if you say, I'm self-realized, no way. Because you still have this ahamkara. So, yeah. This is the graph which tells you that either you perform, underperform, or overperform. And if you do not follow this line in this reddish zone, that means you actually create sources of next activities, and that means you have to again come back and deal with the results of your actions. So I think the just reminder that I have to bring this to a close. What I can say is that even though not everyone is able to really understand why is it so important, it is a path which is worth trying. And if people would see that in some way you are able to manage the life situation in a better way, then we will try to imitate you as the first and then understand what you mean. And this is what I can wish to you also, that if you have the inner feeling, and if you are here and listening to this presentation, I assume that it is there somewhere, then yes, we have to invest in it time and will and energy, but the result is sure to come sooner or later. Thank you very much for your attention. Which one? This one? Or?
One more.
Oh, good. Yes. Thank you very much.
Thank you very much, Professor Timcak, for your insightful lecture. Now it is my privilege to introduce Mr. Paul Golden, an experienced midwife, neonatal specialist, naturopath, lecturer, and legal advisor with over 35 years of international clinical practice and recognized expertise in reproductive rights and integrative healthcare. Please welcome, the floor is yours.
My intention, my aim is to teach nothing. I begin by becoming aware of my own breath. I invite you, if you like, also. One breath. Okay. So constantly at a birth, I'm checking, am I in balance? And I do this by checking one breath. Then the next breath. The baby will come. They always do. We're here. We were born. I invite you to think about the question of how you were born. Because birth matters. It matters with our connection with ourselves, with the world, with everyone. This looks like a pretty good birth. We didn't see it, but we see the connection between the mother and the baby. There's also the connection between the mother and herself, between the baby and themselves, and that will continue through life. This is a short, easy presentation, I hope, that I invite you to interrupt and ask questions during and after, as you like. If something is important. For me, I can hear it quite loud, we see. Okay. It's not about me, it's always about the woman. But here I am talking about birth, so I let you see I used to have hair. 35, 40 years working with birth from Pakistan to Mexico to Vietnam, Australia, New Zealand, mostly New Zealand, and the UK. But we're all multi-dimensional beings. We cannot say I'm a homeopath, I'm a this or a that. We're many things. And in those relationships, when I go into that one breath, when I'm present at a birth, I'm not even conscious of the different roles that I am. I'm conscious of the breath, of being in balance. I'm even conscious of being out of balance. Do I want to react or respond? Better that I take my time and respond. Even if I have to resuscitate a baby, I will take one breath. Observe, get the information, and maybe the baby started to breathe. But if I'm working on a baby, stopping a hemorrhage from a woman, I have to be connected. Now, I'm emphasizing this because I work in hospitals. I've worked in intensive care units, on and off for over 30 years, adults, children, and premature babies. And there's so much love in so many colleagues, but there's also so much fear. The fear is in the upper body. Sometimes I see it during birth. The woman is up here. So by me connecting to my breath, and I go into a room in a busy hospital, everybody in the room just comes down. And it changes and the baby comes. And they're like this. And I'm like... So, as I said, I'm aiming to teach nothingness. Let's go back to that. Ask yourself, what can you see? What does a baby need? What is a baby feeling? What is that mother feeling? Maybe we're putting ourselves into that. Sometimes there is a father present and his touch is important. So pink, this baby. So this is my wish, even if it's in hospital, that mother with the baby, it can happen in hospital, and it does. We need it to be like this. A lot of it is here. If I go to hospital, they'll help me. I cannot do it myself. You can be in hospital and also believe that you can. What's in the environment? It's really what's not in the environment. We don't have a lot of medical equipment, medical staff. We don't have uniforms. We don't have people looking at the clock, which I actually must remember. There's the head of the baby. It's easy to miss the baby is crowning. It's a great word, crowning. Sometimes called a ring of fire. For the woman can experience immense pain that can also turn into ecstasy. And it can be an ecstatic, even orgasmic birth. And it's over. It will be finished. And she's holding the baby. The oxytocin is the highest she will have in her life. We feel good when we're making love, when we have a warm shower, when the sun is on our skin. This is oxytocin. And this is so much oxytocin. And that helps with breast milk production, with safety, with security. And we are interrupting this when we speak. The two words I wish everyone to take away today will be birth can be, to some extent, unobserved, uninterrupted. There's nobody touching this baby. Or the touch there, this touch is loving touch that dynamic wants. But quite often, I can be with a birth, she's there, she's fine, I'm here. I don't need to be touching and talking, saying, oh, have you got a name for the baby? Is it a boy, is it a girl? And so often, we are interrupting this natural process to help. So language matters. Yeah. There's so much power in that image. That's my experience of most births. Even when I'm in hospital, I have 70% in New Zealand of the births I'm at were in water like this. And where is the practitioner? We don't need to pull the baby to touch the baby. The baby will come. It's about 1% of families that need our help. If you think, where did your grandmothers, great-grandmothers, great-great-grandmothers give birth? It was all at home. So I'm not saying it has to be home, but we can make it like home if we go to a birth centre or a hospital. But why not home? We make love at home, we can give birth at home. We don't go to the hospital to be checked with our heart rate to see that we're safe while we're making love. And somebody coming along telling us how well we're doing and just checking if we're in pain. And it is very similar. That baby in a caesarean could be passed with the cord connected under the cloth to the mother onto her chest. I cannot stop the doctor from cutting the cord always. I negotiate, I mediate. I say, how about 3 seconds? And they're like, of course I can give you 3 seconds. Aha. I'm playing the game of momentum as a mediator, family mediator. I've got 3 seconds. Can we make that 10 seconds? You find their limit. But in 3 seconds, you can milk the cord towards the baby once, twice, 3 times. That may be 30 mils of blood with oxygen and life-giving stem cells and everything that will prevent the baby in its whole life having things like cancer, heart disease, Alzheimer's, everything. But we cut the cord and we don't even know why we do it. I go around different countries. I'm in the Balkans quite a lot. I'm smiling because I could ask why for anything and they never have an answer. At least if I ask why in a more developed country, they want to debate it with me. This is healthy. So the impact on the baby at the caesarean, bright lights, the cold air, the air conditioning will be blowing out. It needs to be with the mother, really simple. And to satisfy my colleagues, sometimes I just put a thermometer under the arm, put the baby on the chest. They always think I'm a bit of a weird guy because I'm doing a woman's job, remember, midwife. What's he doing, going by her breast? I just don't have, the baby needs to be there, that's it. And even when a woman's unconscious from a caesarean where she had a general anaesthetic, and I have a trusting relationship with her, and she says, I want my baby at my breast, she's asleep, I get the baby, put the baby to the breast. My colleagues have got the baby wrapped in a cot with a hat on the computer. That baby, a sentient being, has just been born and is being ignored in the corner of a room. So quite a few times I lose the job. I might have a contract somewhere for a few months, and I've taken the baby, put it with the mother, oh, we don't do that here, and we don't employ you anymore. I'm like, yes, thank you. I want to be sacked as often as possible because I'd rather stand up for something and lose the work and shine a light of consciousness in the system. Years later, students and people say, I remember that birth. Because all of us remember our own birth. This is actually my daughter. This birth I was at in Sarajevo, Bosnia. We made a BBC documentary not filming the birth, unobserved. But afterwards, the woman said this. The Tao Te Ching 5,000 years ago said, let them say they did it themselves. That's what I wish my families, my clients, and they do. If we help, we do it in an unobtrusive way. We could do all medicine as much like that. Is it okay if I touch you? Is it okay if I talk to you about the risks of such and such? Not now. Let me know when you're ready. If we ask a leading question with a one-word answer, can I do this, yes or no? There's no third option. For me, it's an invitation. I'm very aware of the gender thing of, is it okay if I touch you? What would you like? And I do far less, maybe because of gender, but hopefully more because of respect. I just see some colleagues diving in there, and it can be so gentle. That's the fourth baby for the woman. She'd had 3 traumatic births. We went to the European Court of Human Rights with a case we lost on process, just the way it was filed. I take lots of legal cases. I will challenge any government any day. Don't hesitate. Fill in the papers, do it. The minute they are a defendant, they behave better. The minute a hospital is a defendant, oh, sorry, we didn't realise. I just have no hesitation. I'm doing some countries at the moment. Yeah. So we have a range of culture. There's the hippie midwife. The father wanted to know who's really responsible, and he needed to hear the words from me saying, I am responsible to get your wife to the hospital to save the baby if there's a problem. When he heard that, he relaxed. But really, the woman and this mother knew it very well. She is responsible. She's making this choice. But it's hard culturally. So many fathers think their wife or their partner is safer in the hospital because of their culture. They've been conditioned, brainwashed. And we've heard here some of the time, allopathic medicine is the number 3 cause of death in America. Yeah, medical misadventure, medical mistakes, drugs, surgery. If we can just wait. So for me, the doing of nothing is I wait a bit longer. The older I've got, the less I do. My colleagues want to touch, they want to help the woman. Are we helping by helping? So we have to go back to ourselves. I'm lucky I spent life in the Himalayas with Tibetan people, then Sri Lanka. I studied homeopathy, acupuncture. I went to Korea and did hand and foot acupuncture. I did Japanese medicine. And in a way, I've stopped doing anything and really focused on doing nothing except being in balance, or if I'm out of balance, just becoming aware of it and moving back. I am also a twin born at home with my brother coming half an hour behind, to my mother's surprise. My mother had a 5-year-old, 3-year-old, 2-year-old, giving birth to her 4th baby, not sure how she can find the funds to look after 4 kids, and suddenly she's got 5. So that's a pretty stressed mum at 25. So that's part of my psychology of why do I want to help mothers? I wanted to help my own mother. So we have to explore and be honest about our psychology. Why are we helping? What's our motivation? And even the whole sensuality, sexuality, male, female, I've got to be comfortable with the work that I'm doing. So what's that journey? I also worked in remote parts of Australia and I needed to know about birth. But if I'm really honest, the psychology was probably my main driver. We can be logical about our work. So this woman, when she had twins by surprise at home in Australia, the midwife got struck off because they're not allowed to do twins, even though she didn't know it was twins. They're not allowed to do twins, vaginal birth after cesarean, and breech. And the reason they're not allowed to do breech, everybody is afraid of breech now. Decades ago, it was a variation of normal. And now everybody's lost the hands-on skill. Because cesarean's so easy, then they want to do that. But cesareans have their own risks now and in the future. So a mother having repeated pregnancies later, those children in the future are at risk, and so is she. Because an egg will often gravitate to where the scar was, in bed, and you have placenta accreta, and this causes massive hemorrhage, could cause loss of life. Better to avoid a cesarean, even if it's convenient. This is in Scandinavia. That is the midwife with the blue top. This is describing without words how to be present without really observing. How are you? Are you okay? Do you need any help? She trusts the woman, and the woman does it. If we keep helping the woman, she won't help herself. We also heard about this in somebody else's lecture yesterday, resilience, and if you had to walk that 20 kilometres or do you get a taxi? If you're always getting the taxi, you're never learning. Resilience. So remember these two words, birth can be uninterrupted, unobserved. What else? So that's her sexual partner. She feels safe in her cave with him. There's so much trust. A woman might bite her partner. She might hang around his neck with her feet off the ground, and he will be his rock, her rock. Quite often a father might say to me, what do I need to do? And I always say, do nothing, just be present. If you need to go out, some fathers smoke cigarettes. Take care of yourself, but be present as much as possible for her. You don't have to fix anything. When she's screaming, I hate you, I love you, I hate you, it's okay. And I see some fathers step up to this, and they can be amazing in balance and strong and present. And others are confused. They didn't do the work to prepare. They thought it was the woman's job to prepare for birth. They didn't even prepare for fatherhood. The preparation, I would say, is two words, walk and talk. So do anything in your body, whether you're walking, swimming, any yoga, and talk, as into the sky, read, think, talk about stuff. If we're not aware, we're not developing, we're like children. And some parents, when the baby's born, are so unprepared. And I see the baby teaching the parents. And that's not a bad thing, but it would be good if we could really be parents and step up. So, back to that beautiful picture. Does anybody feel drawn to share or ask anything? I'm almost going to close on this and invite more questions.
I'd love for you to explain the tradition of... I'd love for you to explain in that last photo to everyone about the placenta and not cutting the cord and what that process is.
Well, wait for white. The cord is a beautiful, thick jelly thing. And if it's around the baby's neck, they're saying in Brazil to all the women, your cord is around the baby's neck 3 times, it will kill it. We can do a cesarean at 2 o'clock. How would you like that? So they all say yes. Then they find out every woman was told the cord was around the baby's neck. The cord protects the blood vessels. It has thick jelly, and you have 3 vessels. Think of the word Java, 2 arteries and 1 vein. It's reversed physiology from the rest of us humans, that babies have oxygenation going in the vein. But anyway, let's get on to wait for white. That could be 10, 20, 30 minutes. Some women have it for an hour. The cord is there, 2 hours. Some never separate it for a week. They wrap the placenta in a cloth with lavender, salt, essential oils, whatever they want to do, Ayurvedic medicines, and they wrap it in a cloth, and it's almost like another baby that they carry around with them. This is called lotus birth. I've only had one client wanted to do that. Some think they want to do it, and then they're, let's get rid of it. And some women have got the baby 10 minutes after the birth. I want a shower, take the baby. What about the cord? I want the cord cut. And they're being impatient because of their culture and their needs or perceived needs. But if we wait for white, the body will tell us what it needs. So when the cord is empty, it's completely white. And on its journey to that, it will be changing colour. So actually at a breech birth, when the head is still inside and the body's born, we can see the cord. It's not a prolapse, it's not stopped working. But over time, if it begins to stop working, we'll see colour change in the cord that tells us, now I have to get the baby out. So from doing nothing, I do everything reasonably necessary and use all the force reasonably necessary to get a baby out if required. But the big difference at a breech, that the medical way of teaching was extraction, pulling a baby, get the baby's head to tilt down and pull the baby by the legs. And the other extreme was to do nothing, and babies died. But in the middle is lift and turn and release a shoulder, release an arm. And that lift and turn prevents the damage to babies. And the medical staff don't generally have that, but that's what I'm teaching tomorrow. Question? You put your hand up.
Hello.
Hello.
I really liked your presentation. Thank you. I'm a medical student in the last year. So
in Czech?
No, in Portugal.
Okay.
And I really liked your presentation. I wished I could do a birth at home. And my question for you is, in medical school, I understand that we avoid touching the baby because that disrupts the flow of energy that's the miracle of life that's occurring in that moment.
Yeah.
But when we learn in medical school, we learn that the midwife usually comes and has to do 4 different positions. First comes the head out, then we rotate the head to...
It's a form of insanity.
Exactly. And how can you program the mother or program the birth so it occurs naturally? I don't know if you... Do you understand the... Okay. Okay.
If you show the doctor your ass, they cannot cut you.
Mm-hmm.
Okay? And they cannot help you. And the over-help with touching and hands is not helping. Mm-hmm. Even on the hospital bed, a woman can be like this and squatting. 30% more the pelvis is opened.
Yes.
That's it.
The first,
and then we take our hands off. We're not touching and saving the mother.
Of course. The first birth that I saw, it ripped my heart out because they usually laying with your legs open. So, and I was standing there and I was like, why are you exactly? You're making the contractions. It's against your pelvis. It cannot come out.
Gravity is opposing you. You see the difference when a woman is squatting. She can have under one arm maybe her partner, maybe a student or the midwife under the other arm.
I completely agree.
This is autonomous. The woman is doing it. This is passive, lying on your back, being saved and rescued and helped by people themselves who probably were rescued and saved, have gone into a culture of wearing a uniform and saying, I will come and save you, not you can do it. We saw those pictures at the beginning. She believed she could, so she did. I'll move through, but Isabel is the great midwife in Portugal, set up independent midwifery.
Okay.
It's my blood. It's theft if we don't give the baby its blood. And that's what we're doing. We used to cut the cords, give them to manufacturers, and the placentas went to face cream companies. So there's me. There's 1 minute. So this baby, I'm at a home birth. I advise the parents because the heart rate's gone down to about 60, so you and I are about 70 now. Babies are about double that, 140. Going down to 60, 70, is it going to keep going down to 0 and die? Is it briefly going down and coming back up because it's just about to be born and it's okay? This wasn't just about to be born, but she got on with it, pushed the baby out, her first baby, and the cord, you can't see very clearly on the slide, is purple, very tight round the neck. And I don't have latex gloves. I know and trust this family. They know and trust me. So we have a much closer proximity of our care. And then I get to see these children grow up. And some of them, their children are having babies with me. So just finishing, 5 seconds. We can resuscitate on the cord. We can use a machine, or we can just let the mother be the resuscitation for her baby. Last slide, there you go. So great home birth. Typically, people call me, say, oh, I don't need you yet. And then I go and camp outside their place in my camper van. And 10 minutes later, when she called me, the baby came. Some others, it can be days or long time that I'm waiting for a birth. But I dedicate myself to one family at one time. It's very different from the production line. So thank you for your attention. And anyone can approach me anytime for more about birth.
Thank you very much for a moving lecture. It is my great honor to introduce Dr. Sarita Shrestha, the first woman in Nepal to earn an MD in Ayurveda, renowned consultant in gynecology and obstetrics, founder of Devi Ma Kunja, and internationally respected teacher and speaker, often called the mother of Ayurveda in West. Please welcome. The floor is yours.
Namaste, everybody. I want to start with a prayer. I hope many of you may have heard or chanted it. I just want to do my own one. Om Sahana Bhavatu Sahano Bhunaktu Sahaviryam Karvavahai Tejasvina Vaditamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Om peace. Let us share everything together in this platform. I have been learning and will be learning. Thank you. So, I come from Nepal. Namaste from Nepal too. And my topic is embracing conscious pregnancy. Okay. So, what I feel is in the field of obstetrics, modern obstetrics, let me say it this way, this word. We have lost the consciousness part. We are so physical. And that's where I feel like where we are heading. When first time I joined my MD degree in Benares, and on the due time of period of my learning process, what I saw was this lack of sympathy and lack of compassion. And at that time, I have decided someday I'm going to change it. And in my birthing center, there will be love and compassion. Thank you, Paul. You did such a wonderful thing. So it has inspired me again. So progeny is the topics, and conscious progeny starts with the conscious conception. How much we are really conscious right nowadays when we are thinking of or planning a baby is a question I think we have to ask now. Is it just a fun, or it is just a plan, or it is a conscious process? So we have to start thinking. So this is what I really want to mention here. Parents are genetic engineers. Isn't that great? We are genetic engineers that we are creating baby who will be the bright future of the world. And that is the responsibility of the parents. And this is why it is said it's the first step of conscious conception. I have many slides, so I may skip some of the slides in between, so please don't mind. So this is the word. It is in Sanskrit. I don't want to recite it, but the meaning is the Ichyatam Yadrisam Putram Tadrupam Charitramasato means during the conception, during you do make love, that is the time. What you imagine or what you think about your future baby is going to conceived by the fetus. It's not. It's, oh, how did it happen? Okay, got it. Thank you. So this is the slide. Okay, I'm not good with the IT, so please remind me, and also remind about the time. I'm not good at both of that. So, yeah. Okay, there. Okay. So you see, this is what Ayurveda has mentioned long time. Like it has a history of 5,000 years. So this is that means when we are thinking about the baby means it's just not a baby. It's about our one vision, our dream over there also. And what type of baby you are thinking about is what we have to plan. And plan means conscious plan. Okay? So this is something, again, Ayurveda is the science of nature. It's never away from nature. And all the examples that we get in Ayurveda is about nature. And here you have the plant, you see in that picture, you have all 5 elements, right? And those 5 elements are essential for human body and especially for fertility. And that's what it is explained in that. So what is 4 factors? Among 5 elements, 4 factors. This is, one is Ritu, means season. Season means timing. Timing is very important. And Chatra, the field, that if you see a plant has to grow, you need land, you need fertile land, right? And then you need nutrition, and that is your water in nature. But that is what we know nowadays is hormone. Ayurveda never talks about hormone. Ayurveda talks about the blood, or the blood that is flown from Artaba Vahashrotas. So that is there. And then you have the Vija. Vija is responsible for our genetic characters. So ovum and seed. Right? So now next slide, I just wanted to bring some of the data that how much genetic engineering really plays the role and what's going on nowadays in the world and how much the load of the problems, the mental problems, and then a lot of the genetic diseases happening is shown over here. So I hope you have seen it. Not only the mental, also the physical diseases, including the NCDs, are also one of the major things that happens. Now, this slide is like more for just to say that Ayurveda has been there. Traditional medicine has been there. It has been practiced for years and years, but it has been replaced by Western medicine almost all over the world. And same thing we are also facing in Nepal. Being an obstetrician, I have been facing a lot of challenges and problems over there. We don't have yet a hospital for birthing. That's why I started one, but I faced a lot of challenges, which I cannot talk right now over here, so I will just pass on. So the other slides, it is about some data again about in Ayurveda in Nepal. Nepal has got the Global Millennium Award for following the UNICEF and the WHO footsteps and practices. But I am sad for that because I could not follow my program and my plan. So it's what is there. Now, one thing I would like to talk about this slide, the right-hand side one. So Nobel Prizes has given to the circadian rhythm, right? And Nobel Prizes has given to the autophagy. Now, when we say autophagy, nowadays people have a fashion of autophagy, right? But in Ayurveda, we don't say autophagy, we say upavasa, right? The word has also difference in consciousness. When we say upavasa, it has got more spiritual link. And when you say autophagy, it is more physical based. So there's so much, even in the words, So consciousness is being, I'm going to say consciousness being in threat. The real consciousness, okay? So there are many level of consciousness, but I'm talking about sattvic consciousness. So these are some the articles that has been published in PubMed. So it talks about how the healthy progeny is possible over, right? And there, these Garbha Karma Bhavas are there. over there it is talked about 6 major pro-factors. And they are from mother and father. And that is the Matrija, Pitrija, Atmaja, Sattoja, and Satmeja. Right? So it means the contributing factors main is mother. Father has 1, the sperm donation. And besides that, all the mother give blood as a nutrients to the fetus. So mother has a great role to play in this engineering. So I will skip this one, and I'm going to the other one. So this is from Srimad Bhagavata. It talks about the Garbha Sanskara. So I want to talk about Garbha Sanskara because Garbha Sanskara is a process where before the conception, preconception and conception and post-conception programs are programmed in this so that we have a healthy progeny. And this is what even Srimad Bhagavath has mentioned about there, and this is another the research article, not the research article, it's an article that has been there. I will skip this one also. This has got this slide has got to say about the role of mind and spirit, and also the physical relationship during the conception. So the importance of that is mentioned about here. Psycho-spiritual process is considered as a conception during the conception. So this is what it is there. Now, this is another thing that I want to say is about the research organogenesis. About the research organogenesis, research has been done, and then it is said that from 6th week onwards, a baby is able to listen. Isn't it beautiful? So baby is connected with the external world, and what's going on is aware. And what's happening in the world now is we are so much, our life has so much, like interruption, so much conflict, so much around of us going on, that is also impacting that small life inside. Now, this is another one. It is also talks about how it affects to the baby inside the womb, right? The Garbha Samskara is one. What's now it is restarted, like I will say it is revived. It has been almost hibernated for this whole process has been hibernated for almost 4 or 5 decades with the domination of Western medicine. Now India has took a very encouraging, daring steps, and it has started now, and then we are also starting in Nepal. So Garbha Samskara means to educate parents and to educate the fetus inside the body so that the whole, during 280 days of a baby, when the baby is growing, will learn the lessons that will lead the person throughout his life, including preventing the NCD disease. So it is like encrypted. It is encrypted in the brain, in the mind of the baby. So Garbha Samskara has such a wonderful role to play. So I will go back. There is the components of Garbha Samskara. So it's a pre, pro, and then you have the antenatal care, postnatal care, and then during the postnatal care, special care is given. So I may have to run a little fast, okay? So here is some pictures. I think I'm going a little bit late with my slides. So this is the pictures. This picture is more on the right side, on the left side. It is during the preconception. We do the yagya with the couples so that both the parents will be prepared for the conception. So this is the whole process explained in Ayurveda. And then on the right, there will be always like holy a saint or a person who will be reciting the mantras. And then you see on the right side, this is the carved, stone carved pictures that is found in South India. It's a long time ago, which talks about sperm, and then it like you can see in the sperm there on the right side, and then the woman with the pregnancy holding by the woman. So it's all happening that time, which we are kind of carrying on even nowadays. Now, nowadays, Ayurveda has started a lot of things of some of the components that we are talking about. And one of this, in Ayurveda, it is very clearly said that before you plan for your conception, you need to detox yourself. You need to do the panchakarma so that the baby will be also very healthy. And there is a saying in Ayurveda that only the clean white cloth, means clean cloth, can be colored better than a dirty cloth. So that's why the panchakarma is done in Ayurveda. So you see the result of the conception. I don't have to explain over there. And on the left, the scene, you see that, right? So life begins over there after the combination of sperm and we call Sukra and Shonita in Ayurveda. Okay? So after the conception, the state of the woman is compared with the woman carrying with the vessels filled with oil. Means so tender. It is so much care is needed. And that's what she has to be taken care by the family. Now the families are so fragmented, right? Families are so small. So you have very little people to take care. In early days, the family used to be the compound family or like the combined family. So there was a chance of lot of the care, love and care, taking care was possible. Where it is nowadays, it is a challenge for especially a working woman, I will have to say that. So we are really facing a problem. The problem, even a pregnant woman is in problem. Now, this is what I am bringing up to you all to think about now. So we are talking about conscious conception, and now we have the woman don't want to conceive because of the consciousness of the figure. Lot of things, this is happening all over the world. I think I am not wrong. And then the consequence of that is now we have artificial insemination and artificial, one of the outcome is that we have in vitro fertilization. IVF is so common. And now, on the top of that, now we have even the womb is artificial. Now, how can we think about the consciousness and what will be the role of consciousness and what will be the state of consciousness? That is the question I am putting on you all. So here, Ayurveda says the aim of antenatal care. Like Paul has very beautifully explained many things. So there is no artificialness. There is no show-off. It is just love from inside, So here in care also, like Sagarbha, the pregnant woman is anupaghataya. There should not be any complications throughout the pregnancy. That is the aim. And then the second is paripurtaya. We expect for the full term, right? Healthy full term. And then the third one is supraja, healthy baby to outcome. That is only the aim. But that aim needs a lot of process. So this this picture tells a lot about what used to have in past. You know, people used to go to the forest. People used to go to the rishis to learn, to listen the stories of the brave people, to listen the stories of the great meditators. So there are all these stories. This is the stories of Abhimanyu. This is the stories of the Prahlada. Now, these practices has been practiced long time ago. Now we have lost this tradition also. So I am not saying we have to follow the same thing, but we have to follow the right path to give the consciousness, the right consciousness, the good consciousness, the sattvic consciousness for the brain, the fetus that growing inside the womb. I have kept this one very much over here, just because we lot of mother, we forget that why we crave and why we have aversion. Ayurveda has mentioned very clearly aversion and the craving is the things that happening from inside. The baby is wanting. Baby, it's likes and dislikes of baby. So we have to honor. If we don't honor, that is going to have negative impact on the baby. So that's what it is mentioned here. And then the antenatal care, I'm not going much in detail over here. It is about, in brief, I will have to say, Ayurveda mentions about the ideal food is milk. Now, this is another controversy in the country. All over the world, milk has become a big controversy. So I have no answer how to answer these questions, because how do we replace milk? And Ayurveda doesn't have replacement of milk. So it has to be milk, yogurt, ghee. That is the best food for a pregnant woman. Nowadays, from the very beginning, this is avoided. So this is another tragedy for me as a OBGYN. So these are the things prescribed for a woman when she is doing pregnancy. I don't want to go with the exercise and all, but it has like storytelling and then reading, writing, even, like gardening and then hugging the trees kind of things are prescribed so that you are with nature and you are giving more nature to the fetus from outside. Here is one photograph. Now, the culture of baby shower and the culture of the similar culture in Nepal, we call dahi chura. Means we give yogurt and rum, the rice flakes, to the mother on the 8th month with some nutrients food so that she have good strength and courage to have the birthing. So this is. So I like the baby showering part. Now, the intention and consciousness over there should be, we have to look at. I am going to skip this one. So these are some studies that have been done on healthy progeny. I'm skipping this also. So I'm coming back to this one. So this is another thing that 1 minute, yeah. So this is you see, and I'm not going to explain because Paul has explained a lot of things. Ayurveda talks about this, and the birthing, the cause of birthing is the detachment of nadi, nature, vairagya. The baby starts getting frustrated being inside. I want to go out. So that's how the baby starts coming out. So it's such a wonderful way to think about, and then detachment starts with the intrauterine life and Kala Prakasha. I'm almost done. This is the practice that's done in Nepal. To the postpartum woman, we give a very special soup made of the ajwain. You know ajwain? It is a trachyspomum. It is almost like celery, kind of, not exactly, okay? Ajwain. So another one is the other one is made of a very nourishing nuts and all, and it has got special gum resin to contract the uterus. So it really helps to postpartum to come to have the postpartum in time to recover. So I'm done almost. These are the studies done over there, right? And this is the kangaroo things is there. Now kangaroo has replaced the old tradition of jata karma that is done in Ayurveda. This is more like feeding the baby, ghee again. So ghee and honey. So I'm not going to talk about this because it's been another controversy. So this is the outcome we want to see. Which one baby you want to have? This one, this one, this one, this one. You want Ganesha, you want any of them, but the best food is there. Thank you.
Excuse me, there is one question from the audience.
Okay.
Ano.
Halo?
Hello.
Dobrý den, Adriana Lor. Já jsem se narodila v Československu, na východním Slovensku. Moje babička byla narozená 1919 a
So her grandmother was born 1919.
A ta už tenkrát mě vyprávěla jako dítěti, že matka, když je těhotná, musí koukat na krásné věci.
And at that time she used to tell her stories such as that once a woman is pregnant, she needs to look at beautiful things.
Aby dítě bylo krásný,
so that the child is beautiful.
Nekoukat na ošklivé obrázky.
Don't look at worst pictures.
Neobklokovat se špatnýma informacema.
Don't absorb wrong information.
Takže to je základ.
So that's the basis.
A další věc, co jsem chtěla ještě jenom takhle, bavili jsme se, nebo bylo předneseno to, co bylo. 3 měsíce před porodem duše krouží kolem matky.
So 3 months before the child is born, the soul is circling around the body of mother. The soul of a child is circling around, is orbiting around the body of mother.
Vybere si rodiče.
And chooses the parents.
To jsem slyšela.
That's what she heard.
Stalo se to, když se narodil náš syn.
It happened as their son was born.
Až začal mluvit, řekl.
And as he started to speak, he said.
Bylo mu asi 1 rok a 7 měsíců.
He was old at the age of 1 year and 7 months then.
Já jsem přišel z nebe a vybral jsem si tě.
I came from heaven and I have chosen you.
Takže to je důležité jako vědět, že ta duše si vybírá také rodiče.
So it is important to know that the soul is also choosing their parents.
Děkuji.
Thank you.
Yeah, it is karmic. Karmically, it's everything happening karmically, and yes, choosing is from both sides. Yeah. And we should not forget one thing. The consciousness is, we think consciousness, we are a single individual. There is individual consciousness and universal consciousness. And none of us are actually separate and individual. We are one. Yatha brahmande, tatha brahmande, tatha brahmande, yatha brahmande. Yatha pinde, tatha brahmande, tatha pinde, yatha brahmande. So this is what applies over there. So I agree, but I cannot prove from science this part. Thank you.
Thank you very much, Dr. Shrestha, for your insightful presentation. And now, ladies and gentlemen, we will take a short break between lectures. Take this moment to relax, network, or enjoy some refreshments. And I look forward to seeing you back at 10:40. Thank you.
Rady odborníků, příběhy s inspirativní filozofií, četba, výstavy, dokumenty z cest i relaxace, pohlazení pro tělo i duši, radioregenerace.cz.
Záhady života. Časopis o mystériích zdraví a duši.
Bude to radost. Bude to mejdan. Český mejdan s impulzem. Skvělou zábavu vám přeje
Zdraví nezná hranic. Hledejme, co nás spojuje. Je čas začít spolupracovat. Takové je motto letošního Mezinárodního kongresu zdraví, který se ve dnech 3. až 5. října uskuteční v Praze. Je určený pro profesionály i laiky, kteří si chtějí rozšířit obzory v oblasti tradiční, komplementární i integrativní medicíny i medicíny založené na důkazech. Zapojit se lze osobně i zdarma online. Loni tak Mezinárodní kongres zdraví sledovali 2000 lidí z 55 zemí. Letos organizátoři slibují informace od předních odborníků z americké Cornellovy univerzity, z britské Cambridge a nebudou chybět přednášející z Brazílie, Indie, Austrálie, Německa, Číny či z Jižní Afriky a řady dalších zemí.
Good morning, ladies and gentlemen. It is my great honor to welcome Professor Michael Frass, Professor Emeritus of Medicine at the Medical University of Vienna, renowned for his leadership in clinical oncology and integrative cancer care, Chair of Wisdom and President of the Austrian Umbrella Association for Medical Holistic Medicine. Please welcome.
Thank you so much. Allow me to talk a little bit about the periodic fever syndrome, or called FAPA. And now we will also put it onto the screen. Thank you so much. It's periodic fever, high fever lasting for a few days. It may be accompanied by aphthous stomatitis, by pharyngitis, including tonsillitis, and or also cervical enlarged lymph nodes. So this syndrome has been described many years ago. The fever may last for about 3 to 6 days, and an average sometimes maybe also 8 days. And it recurs at a nearly predictable rate at around 3 to 8 weeks. So if you imagine every 3 weeks your child is ill for 4 or 5 days, you may lose your job. And the signature symptoms are, as already prescribed, periodic fever after stomatitis, pharyngitis, and or cervical adenitis. The prevalence is increasing. The number of treatment choices has grown, but data from clinical trials are limited to small cohorts. The response to a single dose of corticosteroids is striking. However, parents often report that the intervals reduce. So instead of, for example, 5 weeks, every 5 weeks, it may now be every 3 weeks. And in addition, many parents don't like it that their children at an age of 1 to 3, 4, 5 years are already consuming corticosteroids. The background is that it was first described some decades ago, and it's probably the most frequent non-infectious disease, recurrent disease found in children. And this disease usually starts before the age of 5 years, but it may be also later, of course, and it generally resolves by adolescence. But it may last for many, many years. I know children who have this symptom for about 10 years. The patients are usually asymptomatic between the episodes. They show a normal growth, a normal development, and it may be an acquired autoimmune inflammatory disorder recurring without clinical signs related to upper airway respiratory disease or other localized infections. The disease usually has a rather benign course. It might relapse during adulthood after a spontaneous or treatment-induced resolution in childhood, which has been described in 2017. The presence of variants in inflammatory inflammasome-related genes, mostly in MEFV, suggests a possible role of these genes in Fabry pathogenesis. Now, this is a diagnosis as described by Venkata in 2017. Children are suffering from regularly recurring fevers with an early age of onset, more or less 5 years of age. And the symptoms are occurring in the absence of respiratory infections with at least one of the following signs after stomatitis, pharyngitis, and or cervical adenitis. But some of the children experience all of these clinical signs. A cyclic neutropenia should be excluded. It should be completely asymptomatic between these episodes, so there should be no bowel problems and no skin symptoms and no rheumatic diseases. And the children show normal growth and development. The treatment choices are, as already prescribed, cortisone, but this is something which many parents don't really like, and tonsillectomy may be another choice. However, many pediatricians, rheumatologists, and otorhinologists, they said they're not convinced of this way of treating Fabry. I have treated about sorry. What was the right? Yeah? Okay. Okay, sorry. So far, I have treated about 30 children, and all but 3 have reacted positively to individualized homeopathy. Some of these children react immediately, or some of them within a relatively short period of time, up to about half a year. Once in a while, a family was coming, and the father of the child, he was very skeptic about homeopathy, as it is usually in human males. And At the end of the treatment, of the anamnesis, of the history taking of his daughter, he said, I'm suffering from a special type of alopecia, and can I do something? I said, okay, we can try acetum hydrofluoricum, and maybe it helps. If it helps, it's good. If not, we have to make a special analysis with you. Next time, when this family came again, the child was completely healthy after one single treatment, and also this folding of hair has disappeared. So now he was convinced. This is the usual way that male come into contact with homeopathy. They have to see it first. They cannot imagine. That's the difference between males and females. At the anamnesis, this boy was 4 years and 6 months old, and because of a polycystic ovary syndrome of the mother, an in vitro fertilization was performed. It was a difficult labor. The boy faced his face up, so-called star Gejza, and therefore a cesarean section had to be performed. And the mother suffered from postpartum depression. Usually in homeopathy, pulsatilla or lachesis may be a very important remedy in these cases. The child was breastfed for a year with extreme digestive problems, with alternating diarrhea and constipation, and the parents divorced in October 2018. Now, the boy is regarded to be highly sensitive. He speaks very well and intelligent. Before he suffers from something else, what can happen then? So he's very cautious. And he's shy, reserved, he's not a daredevil. And half a year ago, the boy suffered from mononucleosis. His right side was swollen together with axillary inguinal lymph nodes on both sides. And in addition, he was suffering from splenomegaly. Now, another homeopath had treated the boy by help of lycopodium. You know, lycopodium is more on the right side, and it also helps to decrease swellings on the right side of the neck. Now, this Papa disease appeared at the age of 12 months. It occurred every 5 to 6 weeks with a fever up to 41 degrees of Celsius for 1 week. Antibiotics don't help very much, as well as antibiotics also don't help. And of course, in my eyes, antibiotics are not very useful. Papa was diagnosed by a pediatrician, and almost for 4 years this problem lasted. And then for another 8 months, the fever occurred now every 3 weeks, not 5 to 6, but every 3 weeks. He sleeps a lot, he's very calm, up to 40 degrees, he's not in a bad mood, he's not aggressive, and the beginning and end takes place very quickly. In case of fever, the patient has a red face, sore throat, and swollen cervical lymph nodes on the left side. Now, there's no sensitivity to light or noise, as it is usual with belladonna. Now and then he's suffering from headaches. He has warm hands, but no after ulcers. And 2 weeks ago, the patient had 41 degrees of Celsius for 6 days while on vacation in Italy. He was treated with cortisone, and fever disappeared for 1 day, and vomiting occurred the next day, which he never had before. And now, opposite to the materia medica, I prescribe belladonna CH200 once a week for 4 weeks, with the rapid and sudden end of the fever and the red face being the decisive factors to decide for this homeopathic medicinal product. In English, you know, it's homeopathic medicinal products. And because of the high sensitiveness and the grief after the divorce of the parents, I gave him natrium muriaticum. It may also be called natrium chloratum, more or less the salt you're eating every day, in an LM6, 5 globules daily for 3 weeks. After a follow-up, after 6 months, the mother reported that the boy has been completely healthy since this time. There were no more fever attacks since the first treatment. And since I would like to make a study, but it is extremely difficult to find colleagues to cooperate, and it's also very difficult to get the money together for a real comparative study. I just published this retrospective case series. I published the history and symptoms from 10 out of 13 children, who were consecutively treated because of Fabry symptom. Mean age was 3.5 years. The clinical outcome was assessed using the modified Naranjo criteria for homeopathic causal attribution inventory. And if you have more than 8 points, then there's a presumable correlation between homeopathic therapy and improved symptoms or cure. And I used homeopathy in a classical way using individualized prescribing. 9 out of 10 children recovered within 1 to 5 months of treatment. The median follow-up was about 36 months. And mostly I used Atropa belladonna, calcium carbonicum, mercurous solubilis, phosphor, and pulsatilla pratensis. So in my eyes, there was a time-dependent improvement with regard to frequency of flares, as well as of the intensity of symptoms, up to a complete disappearance of disease. Some parents also reported there was, besides the physical improvement, there was also, in addition, a developmental behavioral leap. So in conclusion, this case series suggests that individualized homeopathy is a potential therapy option in patients with Fabry. If you understand German, we would like to translate it into English. You could buy this book. It's very big, so in case you don't read it, you can also use it in a cold winter for heating. And I want to thank you for your attention. I hope this is the correct translation. And many years ago, I was here with Professor Dr. Pavel Dyszyński, who has worked in my intensive care unit about 34 years ago. Thank you so much for your attention.
Thank you very much for your inspiring presentation. And now it is my great honor to welcome back Dr. Dilip Ghosh, global expert in nutrition, nutraceuticals, and traditional medicine, professionally associated with NutriConnect Australia, adjunct industry fellow at the National Institute of Complementary Medicine, Western Sydney University, and consultant to the WHO Global Traditional Medicine Center. Please welcome.
So today, my topic is slightly different, although it's very interesting. How to globalize Ayurveda, not through classical Ayurvedic route, but through evidence-based nutraceutical route. Because I am one of the nutraceutical experts in the world, so we have done a lot of work in this area, using Ayurvedic medicine also. So I would be happy to share my knowledge also. As you increasingly aware that the one disease, one target, one drug, that is the concept of or backbone of pharmaceutical drug, that is, in today's world, it is slightly outdated. Because every disease is completely not a single cause. There are multiple causes. And maybe 30, 40, 50 genes are involved to tackle this disease also. So one molecule, you cannot control every pathway of the disease. So that's why the multi-target therapy or pharmacology that is appears, and that is perfectly fits with the natural medicine, including Ayurveda. Because Natural medicine has sometimes 20, 30 individual components also. So that means if you studied well, you can easily connect all these physiological pathway. So this is the disclaimer. If I mention any brand or any company name, I can guarantee you there is no financial connection with them. If I use anything, that means I have been in the developmental phase of that research. So that means I own this research. And also, I am not an Ayurvedic practitioner also. But globalization of Ayurveda is not only Ayurvedic practitioners' role. I think it is the policymaker, influencer, or communicator, their role. And I am playing within my capacity, that area. So few books I showed yesterday. These are all published by the CRC Press or Academic Press, the world 2 top publishing house. If you are interested, you can go through this one. These 2 books just published. I mentioned yesterday also, I have only limited time today. So, Ayurveda, shining globally. Maybe I met 30, 40 people here. They are directly involved with Ayurveda. And within these 350 to 400 people, 50 people directly involved with Ayurveda is a good number. You can see the contribution from Ayurveda. I am not going to explain every slide. It will take 1 hour. The respirin to polysaccharides, you can see all sources from the Ayurvedic herbs, from Raufelia, Serpentina, Totinospora, cordiafolia. This is one very good slide, one eye-opening slide. And everybody should know that. Ayurveda as a system of medicine, that is one thing. But Ayurveda as a product, that is completely different. So only 16 plus 4 countries, roughly 20 to 21 countries, they recognized Ayurveda as a separate system of medicine. So these are the list. There are few good number of European countries also. So, yes. So Ayurveda pharmacopoeia, I think there are, some 121 pharmacopoeia in Ayurveda, small to big one. So these are recognized in Sri Lanka, Nepal, and Bangladesh. So countries using Ayurveda pharmacopoeia as a reference text, like Malaysia, Singapore, UAE, Serbia, and Switzerland also. And Switzerland, it is very prominent because the Swiss Medic, who is the regulatory bodies in Switzerland, they also recognized these Ayurvedic pharmacopoeia. This is last month, the Ministry of Ayush, 25 country-to-country MOUs is just 1 year, 52 institute-to-institute MOUs, and 5 Ayush chair MOU also. The ministry signed only last year. And we got 1 Ayush chair in Australia also, 1 year back. I worked hard for 1.5 years. Then we got the Ayurveda chair in Australia also. Sorry. So you can see these are all shining picture. Ayush startup, 40,000 active MSc ME. This is a very good number. Growth, 20,000 crores rupees to 1.5 lakhs crores. That means 7.1% 1 times increase in 7 years. That's a phenomenal growth in Ayurveda. Global market is $120 billion. But it is some sort of inflated figure Because when we are talking about global market, we include both Ayurvedic formulation product and also the Ayurvedic ingredients or extract. Ayurvedic ingredients, almost 80% of this number, only 20% is the formulation part. So because those countries, they recognize Ayurveda as a separate system of medicine, they can import all this Ayurvedic formulation. And many previous speakers, they mentioned, WHO set up 3 years back, that is the Global Center for Traditional Medicine in India. 172 countries are involved there, and India is leading this center. And I was nominated last year consultant at WHO GTMC also. So these are the benefit. I think India will get a lot of benefit from this WHO center, because still Ayurveda is good for Indian market, but not good for the foreign market, because they don't have such high-level documentation also to convince the overseas regulator to approve the products also. There are many challenges. Pre-globalization, acceptability is one of the challenge. Adaptability is another challenge. Post-globalization is managing knowledge, because there are not many Ayurvedic practitioners or Ayurvedic knowledge person who can disseminate this knowledge also. So this is one of the big challenge. Integration with the other medical system, whether it is allopathic medicine or traditional Chinese medicine or bush medicine in Australia also, and the competition. Because when you go to disease control or disease treatment with allopathic medicine, there will be a huge, huge competition. Because Ayurveda, it is not like the paracetamol. You take within 20 minutes, the fever will drop. So people has to wait. And just I am sharing one knowledge. I launched one product based on Bacopa, that is for cognitive enhancement. But the post-market feedback, when people are taking this medicine, they thought it will act like a magic. So within few hours or within few days, I will get some benefit. But it is not like that. You have to wait at least few weeks to few months also. So that is competition is one of the area. And if you see the WHO state, 172 state, what difficulties they face: lack of research data, lack of financial support, lack of mechanism and monitor safety also, to the lack of appropriate mechanism to control and regulate also. So some 98% and some maybe 20% also. So I will give you one case studies, that is fenugreek. I have done a lot of work in this area, and I published this a big book on fenugreek. If you see the title is Traditional to Modern Medicinal Movement. How you can translate the traditional knowledge into the modern medicinal way. This is the book. If you are interested, there are 27 chapters. 90% are based on the clinical trials, and these are all double-blinded, placebo-controlled trials. So you know fenugreek. So we called methi in India. It's very, very popular in Egypt, Middle Eastern country, outside India also. Flavoring agent, culinary spice, and food. It is mentioned in the Ayurvedic, Greek, and Latin Pharmacopoeia, USP Herbal Medicine Compendium. 4,000 years very old use of things, abundantly available, and the safety dose is very high, 100 to 150 gram. So I am going to skip these things. So what we did, we isolated 4 active components from the fenugreek extract. Amino acid part, This is mostly the 4-hydroxyleucine. We isolated alkaloid part, that is for antioxidant protective. We isolated glycoside part, that is anti-inflammatory. And we isolated very special type of fibers, that is the glucomannan from this one. We have 88 patents only on fenugreek. Can you believe that one? Only on fenugreek we have 88 patents. And we have published so far 101 scientific article in a peer-reviewed journal also. You can see this area, amino acid, alkaloid, glucoside, saponin, soluble fiber, insoluble fiber, and protein plus fiber. The green means the product already in the market. It is not only Indian market, it is present in the Western market also. And you can see the disease area we are covering. So I will give you very quickly 3 different areas where we develop this product and we launch also. In Australia, also in Health Canada. And definitely in South Asia, like India, Nepal, and all other countries. So I'm not going to cover this one. This is the glycoside part of fenugreek, proven efficacy and safety of the 2 independent human clinical trials. It is not only done in India, the one trial is done in Australia also, and this is double-blinded placebo control. We are not claiming in the sexual arousement area, but we are claiming the free testosterone increase. You know, after 40 years, women also need testosterone. Testosterone not only for men. So the free testosterone is dropping down. We have to increase this to maintain our all activities. But this one, this fenugreek particular fraction, they increase your free testosterone. It is not under that called illegal drug for the sportsman. Because it is not directly things, it indirectly increases the free testosterone. And it is approved in Australia, Health Canada, and Food Safety Standard Authority in India. So these are the 2 studies we have done. One is the single dose study in India, and another one in the multiple dose 8-week study in USA also. And both are double-blinded placebo-controlled trial. So approved health claims, maintain, support healthy body, fat, muscle composition in male athlete, maintain, support the testosterone level in the healthy males. So these are all in the healthy aging platform. Fenugreek as a proprietary Ayurvedic medicine, because it is India, we registered as a Ayurvedic medicine, and as a Ayurvedic medicine, you can claim any disease treatment also using this product. It is the sugar hill, that is the amino acid part, especially the 4-hydroxyleucine part. You can see backed by the 2 published clinical trial, supports healthy blood sugar level and maintain HbA1c level in the optimal range also. I am not going detail. Approved health claims support healthy blood sugar level, maintain H1A1C level, and may reduce the daily requirement of external insulin also. Nutraceutical, this is the Fenuflex. It is one of the hottest product in the market now because the fenugreek that fiber has 23% of protein. So we are taking all natural protein from peas or some other sources. But fenugreek is the new phenomenon in this area. So we debitterized, because fenugreek is very bitter, we debitterized and defat. So only protein you can get. So manage blood glucose sugar level, lowered GI, and improved gut health. The only fiber in the market with protein in it. When you compare the amino acid component, you can see there are a fantastic balance of good amino acids also. This is the health benefit. You can add in the cereal, beverage, breads, noodles, and powders also. Clinical data, we have done 2 big clinical trials also. and few are undergoing in this area, and definitely the gut health area. So because it's a high fiber, especially the nano, not nano, that is the glucomannan, so it will improve your gut health also. Approved health claim, source of protein, high fiber, low available carbohydrate. Thank you very much. Any quick question, or I am here? Thank you.
Thank you very much, Dr. Ghosh, for your insightful presentation. It is my great honor to welcome Dr. John Hughes, Associate Professor in Integrated Medicine at the University of West London and Head of Research at the Royal London Hospital for Integrated Medicine, internationally recognized for his work on chronic illness and integrated medicine. Please welcome.
No problem. Morning, everyone. Dobra rana. I'm John Hughes. Like just introduced, I'm Head of Research. That's the Royal London Hospital for Integrated Medicine. On the right-hand side of the screen for yourselves, that's the largest public sector provider of integrated medicine within the UK. And I head up the hospital's research department there, which is the largest research centre for research into TSIM, traditional complementary integrative medicine, within the UK as well. Currently, we've got just over 30 research projects going on at the hospital. Oops. That includes, we've got just shy of 10 PhD students with us at the moment, and 4 or 5 medical, healthcare professionals doing their research with us as well. So that's medics, clinical psychologists, child psychologists, and so on. We have a broad range of research at the hospital, although what we do is specialise and focus on those interventions that are either already within the UK's National Institute for Health and Care Excellence, the NICE guidelines. So that's things like acupuncture, Tai Chi, yoga, manual medicine, as well as psychological therapies such as mindfulness, hypnosis, and CBT. Or those interventions with a realistic possibility of being included within the NICE guidelines. But the focus of the talk today I'll be giving is specifically around acupuncture, acupressure, and the research that we've been doing within oncology. So I'll be covering the practice of acupuncture within UK oncology briefly. I'll look at traditional Chinese medicine or traditional theoretical frameworks for diagnosing patients with cancer, and then look at some of the research that we've conducted at the hospital around acupuncture, acupressure for cancer. Okay, so currently I mentioned the NICE guidelines before. At the moment in the UK, NICE guidelines, acupuncture is included in the NICE guidelines for 5 symptom stroke conditions. It's in there for tension-type headache, migraines, chronic primary pain conditions such as fibromyalgia, complex regional pain syndrome, and so on. It's recently got introduced as well for hiccups and for prostatitis symptoms as well. So at the moment, if somebody's a UK NHS patient, they should be able to access on the NHS acupuncture specifically for those conditions. In addition to that, some NHS centres in the UK, and in particular oncology hospitals, also provide acupuncture. It's quite common for cancer centres in the UK to have an acupuncturist who is delivering acupuncture to the cancer patients for the alleviation of the cancer symptoms and the side effects of their conventional treatment. Now, looking at traditional diagnoses within acupuncture. I'm sure a lot of you will be familiar with the idea of qi and the meridian system. So there's many forms of traditional theoretical frameworks for diagnosing within acupuncture and acupressure. Within Europe, some of the main theoretical frameworks would include traditional Chinese medicine, five-element theory, stem and branches, and the Japanese meridian theory. In each of those theoretical frameworks, there's a focus really on the individual and the individual's presenting symptoms, and treatments can vary quite significantly between different individuals, even with the same conventional medical diagnosis. I've put in bold there at the bottom that although practitioners, that this is a theoretical framework, and although practitioners are diagnosing based on this theoretical framework, currently there is no scientific research that has confirmed either the existence of qi or the meridian system. These are theoretical frameworks that the practitioners are working with. Now, the previous colleague was mentioning about the work that the WHO does. I'm also the head of the hospital's WHO collaborating centre, and I work with the WHO in a number of ways within traditional complementary and integrative medicine, and in particular with the work they're doing on traditional medicine ICD codes. So a few years ago now, the WHO developed traditional medicine ICD codes specifically for traditional theoretical frameworks according to that originated in China but's now spread around the world. And basically what the WHO did was combined TCM with the traditional theoretical framework for diagnosis within Japan and within the Republic of Korea. And I was involved in assessing the relevance of those traditional medicine ICD codes within Europe specifically. So we asked acupuncturists across all European countries around their views on those draft traditional medicine ICD codes. And that resulted in some changes to the WHO's ICD codes. Just in brief, the European practitioners that did participate in it perceived those ICD codes to be valuable, conceptually accurate, and to incorporate the range of diagnoses utilised within clinical practice. Now, we're continuing to do work with the WHO regarding these traditional medicine ICD codes. And in particular, the WHO are interested in understanding what the dual correlation between dual diagnosis is. So how a traditional Chinese medicine diagnosis correlates with a conventional Western diagnosis, and what, if anything, is the clinical benefit to patients from receiving those dual diagnoses. We've also recently set up a minimum data set, which all WHO member states are being encouraged to collect data around. And these relate to the traditional medicine ICD codes. And this includes data on patients' demographics, age, gender, their conventional medical diagnoses, as well as what treatment they've received. There isn't a global collection of outcome measure from these consultations. However, individual member states are being encouraged to collect some outcome measure data as well. And certainly that's what we'll be doing within the UK. Now, moving on to the effectiveness of acupuncture, acupressure within cancer. there's been a lot of research conducted now on acupuncture, acupressure within cancer. And that research has largely shown that TCM interventions are effective, well, acupuncture is effective for a variety of symptoms associated with cancer and its conventional treatment. So things like pain, nausea and vomiting, xerostomia, dry mouth, as well as things like anxiety, peripheral neuropathy. Now, I'll just briefly give you a bit of a whistle-stop tour of some of the research that we've conducted ourselves on this topic. So the first one, I know that the text is a little smaller to read, but the first one was a large randomized controlled trial of acupressure wristbands versus sham wristbands versus no treatment. It was funded by the NIHR in the UK at a cost of over £500,000. We had over 500 participants in the study, and what we actually found was that there was... So patients reported benefits from using either the real wristbands or the sham wristbands. If the participants in either of those two arms benefited compared to those with no treatment. However, quantitative outcome measures, we did not detect any real difference between those with the real sham, with the real acupressure wristbands, and those with the sham acupressure wristbands. Now, largely, you would generally conclude, well, your real wristbands are no better than a placebo. And that may well be the case. However, there are some extenuating circumstances here. We had a ceiling effect, basically. The conventional chemotherapy, it was looking at nausea specifically. And the antiemetics that are used now within the UK are very effective. All of the participants were receiving these antiemetics. We didn't see as that much nausea across any of the three groups. We conducted qualitative interviews with the participants as well, and we know that a number of the participants were not using the wristbands accurately. So a number of people who got the sham wristbands were manually applying pressure to the acupuncture point, pericardium 6. So there's a couple of possible explanations, but yeah. Second one is a small pilot feasibility trial looking at auricular therapy, where you attach the semen vicari seed to auricular points versus self-administered self-acupressure versus no treatment. And this is looking specifically at insomnia within cancer patients. A lot of cancer patients post-treatment are still left with the symptom of insomnia. So we were seeing whether we could give them a self-management technique that would improve that insomnia for them. We used the PSQI insomnia scale to assess the impact of treatment. Those in either of the two active treatment arms were asked to manually apply their treatments on an evening, an hour before retiring to bed. And I'm pleased to say that with this one, both of those interventions appeared to be effective. Both were clinically effective for the patients that were receiving those interventions. However, the caveat with that is that this is a small pilot feasibility trial. Those findings would need to be confirmed in a large phase 3 randomized controlled trial, which at the moment we haven't took that one forward yet. More recently, we also did a large randomized controlled trial. Again, this one is about £500,000. This one was specifically actually looking at whether we could train radiotherapists to deliver acupuncture to cancer patients. It was a large feasibility trial, so we were assessing aspects of the research design as well. The focus, the primary objective, is not to ascertain whether the acupuncture was beneficial for the patients. The primary objective in a feasibility trial is to assess whether your methodological design is fit for purpose and whether that needs to be amended, tweaked in any way before taking it to a phase 3 definitive trial. Again, within this one, we found that the methodological design was fine. It's perfectly acceptable to treat the radiotherapist to deliver the intervention. All of that aspect worked well. The outcome measures and everything with the trial, that seemed to be fine. And the participants in the qualitative component of that trial, again, reported that they felt that it was valuable for them to be able to receive that treatment within the NHS, and they reported benefits for them clinically as well. However, a bit like the earlier one, we didn't find any statistically significant difference between those receiving the acupuncture versus those receiving standard care. Moving on to the slightly contentious issue of self-acupuncture. We've got a program of research going on at the hospital around whether we can teach patients how to administer acupuncture to themselves, to convert what is a safe and effective intervention into a safe and effective self-management intervention. So we've got a number of studies going on at the moment around self-acupuncture. It's actually been taught to patients at the hospital since the 1970s. Despite its long use clinically, there is very limited research out there around how safe or effective self-acupuncture is for patients. So we're trying to address that evidence gap at the moment. We've just completed a feasibility trial of self-acupuncture for chemotherapy cancer patients. We're currently crunching the numbers to see how effective or not that intervention was. The aim was to recruit 80 participants. We didn't hit our target population. Those who got randomized to self-acupuncture had an hour and a half dedicated session with an experienced acupuncturist who taught them how to insert a limited number of acupuncture needles safely into their own body, the points being on the leg, and the participants were asked to insert these needles a couple of times a week. We're still crunching the numbers, however, it does appear as though self-acupuncture is certainly acceptable to the participants, and certainly from the qualitative data that we've already analysed, the participants who were randomised to be taught self-acupuncture, they certainly perceived it as being acceptable. They were able to do the self-acupuncture and they perceive it to have had beneficial effects in terms of their cancer symptoms and the side effects of the conventional treatment. We've got other studies that are just starting within acupuncture and cancer. One of a PhD student that's just starting with me now, they're looking at auricular acupuncture for cancer pain, and we're about to submit a large research grant for a phase 3 definitive trial of acupuncture for peripheral neuropathy in cancer patients as well. So this is an area that we're continuing to work in. In brief, though, as a summary, the UK's NICE guidelines do not currently recommend acupuncture for oncology, though many NHS cancer hospitals will provide that treatment. There is strong evidence for acupuncture in particular, and to a lesser degree, acupressure, being able to provide an effective intervention for the side effects of the conventional treatment of cancer. So things like pain, nausea and vomiting, xerostomia, and so on. And we're continuing to conduct research to explore whether those effects can be seen if we teach the patients to do the acupuncture themselves. Thank you.
Thank you, Dr. Hughes, for your insightful presentation. It is my great honor to warmly welcome Mr. Joerg von Bergen, founder of Gejza and dedicated coach with decades of experience in carpentry, supporting people with disabilities and practicing radionics. He brings deep expertise and a lifelong commitment to guiding others. Please welcome. Please welcome. Yes.
Hello, everybody. When you go to a doctor to make an analysis of your blood, you get a result. But if you want to know what it is, the meaning of the energetic, then you come to a radionic person. We can find the solutions. We can find the one second. So we can find solutions why we have blockades, why we stocked, why we cannot make steps in terms of that we ask the energetic field. So Abrams, in the 1920s, he found the radionics in the early system. And since then, individuals and firms did develop the radionic system as it is today. So what do you need to do radionics? Radionics is a tool. Radionics, you need a computer, the hardware to it, and a profound knowledge how to use it. So who can use radionics? Radionics can use doctors, therapists, coaches, but also individuals. So if you have a firm, you can use also the radionics to see more deeply why things are not developing, why things are stocking. And why should we use radionics? Radionics, when we open the field, and this is, we have to make a resonance with a person, with a firm, with an animal. That means we need a name, we need address, we need a photo, so that we can make resonance. And we use the morphogenetic field. Rudolf Sheldrake called it the morphogenetic field. This is the field around the world. So we don't need an internet. We use this field directly. So that means we just make a resonance with our client, and nobody else can touch it, because this is the resonance is built up. So when we analyze, the people come and they have a question. But behind this question, there is the reason why they come. And when we talk to each other, the listener does give the meaning to the word, to the spoken words. So many times when we speak, we don't get the answer of what we asked. So in the radionic, we get a sheet where it is written, for example, I never trust myself, and the identity, the intensity is named, and so we can point out on a written way that we really can point out the subject where you are in, that you can make progresses. When you make progresses, because you got in resonance with what it is written, yeah, you can feel it, and you can feel it in your body as well. So we can use the body to feel, you know, where this is. Like you don't trust yourself. Is it in your heart, or we can just locate it, you know? So we have the possibility to find out where in your body could it be better. So we can get it out of this place where you're always stuck. This is the way how I work. And when you are a doctor, you have another background, and you can work as well with the same written words in another way. And most important is that you are guidelining the people that they can find the solution to develop. So when you make steps, these steps, you don't see them anymore. And this is the most important part, that when you don't see this point anymore, like you have more trust in you, this is not visible anymore for you. But this is important to improve, that you give attention. When you have a firm, you can use the radionics as well. Like you have different places. You can relate with the headquarter and another place and see where the problems are. Are they connected with the headquarter, or are they just in this other place where the people have any issues? Where you can see them in the radionics. So you can change, you make changes in terms of that. You can point them out, and the people can make understanding. They can understand why things don't float. So sometimes you like to make steps, but you don't have enough energy. That means we can put the energy in the morphogenetic field, that you can get more energy to improve. That means suddenly you can make advantages, you can make steps forward, and because you have enough energy. So sometimes people come and they don't know why. They have an issue. And after they can make these steps, they can find in another way why they came to us. When we work with animals, animals is also possible because it's a living system. And everything which is alive, we can make a resonance. So when an animal has an issue, for example, is afraid of something, we can, in the radionic, see the energy way, why this dog is inconvenient. And we can also help this dog or this other animal, doesn't matter, that this energy comes up and just develop. So if you have any question to me, please ask me.
Thank you very much for your interesting input. Now, I know maybe I was not listening carefully now, but can you explain what you understand under radionics? So you have developed the frame in which we can use it, but I personally am not clear in what way do you use. So what instruments of the radionics are you able to use for getting to the results which you outlined? Thank you.
It is a computer system. There's databases, and with these databases, we can ask over the morphogenetic field what is the issue. Yeah, and because we make a resonance, we can ask that directly. So when we ask this over the morphogenetic field, then we have the possibility to get that in written form. But in the radionic, it is also you cannot have that many databases that you can have an answer to every question. So that means when you read it, you have to be able to read it, what it does mean. But it is not the radionic who knows. It is the person who comes to you, because it is important that when you get this information, that you can feel it, what happens with you. You know, why can you not make steps? Why don't you understand? That's the radionic, what we do. Is that clear enough?
Evidently, I'm a little bit dumb, because I didn't get what type of data and what type of software are you using to connect to the morphogenetical field.
In this computer program does work over colors, over waves. We have everything is waves, everything is energy. And that's why we can ask over these energy fields the person directly. Yeah.
Thank you so much. So just a related question. So what it means that you have a specific hardware?
Yes.
Thank you.
I can show you. You see, we have different kinds of programs where we can use that. If you are a doctor, you use other programs. Yeah, you use other programs than a coach. Yeah. I prefer to use the Aura Coach, because there I can see in all the chakras where there is not enough energy. And when in the radionics, when the subject is, when you make the improvements, when you don't have this problem anymore, it doesn't appear. And that's how we also know that the person did make the development. But also what's very important is that what you don't feel anymore, there you can make the progresses. And this is the meaning that you really have to be aware what is not here anymore. So, as you see, all these different programs, you can have them modular. There are people that they use different ones, yeah, and there are people that are just using one. That's okay, because you will always come to the same conclusions. If you have any questions, if you want to see the program, if you want to know more details, you can talk with me, or you can also send an email, and I will answer any question you have. Thank you.
Thank you very much for your inspiring presentation.
If you like to have a talk, you can just have a talk.
Ladies and gentlemen, I am now delighted to introduce Dr. Antonietta Rozzi, Professor of Pedagogy and Yoga at University of Bologna and Bolzano, President of Sarva Yoga International, Honorary President of Federazione Italiana Yoga. Unfortunately, Dr. Rozzi could not join us today. However, she will kindly share her greeting and warm regards to all of us.
Greetings from Italy to all of you gathered in Prague for the first World Health Congress 2025. Unfortunately, I'm unable to attend in person for family reasons, but I would like to thank Thomas and all the organizers for the opportunity to have at least a brief talk with you, and also to greet my friends and distinguished speakers, guests, and participants. I would like to briefly inform you of some news and events occurred recently regarding the dissemination of a message that all of us are spreading as a representative of various disciplines, and with the common goal of promoting new or ancient way for maintaining or restoring health using traditional and complementary medicines. For several years, I have been a member of a joint commission of the Indian government and WHO for the development of a global health strategy through yoga methodologies. Yoga is officially included as traditional medicine since the 2014 WHO declaration, and strategies have been developed since then, not only in India, but also around the world. Recently, the Indian government has once again convened a commission to establish quality standards in yoga that can provide guarantees to users and stakeholders. The commission is preparing a document, still to be perfected, to provide yoga general and globally applicable references point for governments and general public. This could maybe serve as a model for other disciplines too. At the national level, a proposal has been submitted to the Chamber of Deputies of Italian Parliament by some government deputies to introduce traditional and complementary medicine and other methodology too into the national health system. For now, it's only a proposal, and we know how long political process can be. But, however, this is and shows a significant interest in the more official inclusion of alternative therapies, particularly for prevention of health in society. Another interesting activity our association, Sava Yoga International, have developed with the cooperation of Romania Yoga Association. It's an experimentation and research on the validity of yoga in improving the quality of life in elderly in an Erasmus project for adults of the European Union. This also shows an important opening of the institution toward different and innovative solutions for health of societies. Another significant event I would like to share with you, it's a cultural exchange with Italy and India for the 20th anniversary of our association. It will be a conference in Delhi and then a tour in the main school of India in collaboration with the Ministry of Ayush. Ayush means Ayurveda, Yoga, Unani, Siddha, and Homeopathy, with the theme concerning individual and social health and well-being. The theme is Yoga, the Science of Tomorrow. With this news, I bid you farewell with affection. Thank you for the opportunity to send at least the message, and my best wishes to everyone for a wonderful conference with the hope of seeing you soon again. Thank you.
Thank you very much. Ladies and gentlemen, we will now take a lunch break. Take this moment to relax, network, and enjoy your lunch. We look forward to seeing you back at 1 p.m. Thank you.
Rady odborníků, příběhy s inspirativní filozofií, četba, výstavy, dokumenty z cest i relaxace, pohlazení pro tělo i duši, radioregenerace.cz.
Záhady života. Časopis o mystériích zdraví a duši.
Bude to radost, bude to mejdan. Český mejdan s impulzem. Skvělou zábavu vám přeje
Zdraví nezná hranic. Hledejme, co nás spojuje. Je čas začít spolupracovat. Takové je motto letošního Mezinárodního kongresu zdraví, který se ve dnech 3. až 5. října uskuteční v Praze. Je určený pro profesionály i laiky, kteří si chtějí rozšířit obzory v oblasti tradiční, komplementární i integrativní medicíny i medicíny založené na důkazech. Zapojit se lze osobně i zdarma online. Loni tak Mezinárodní kongres zdraví sledovali 2000 lidí z 55 zemí. Letos organizátoři slibují informace od předních odborníků z americké Cornellovy univerzity, z britské Cambridge a nebudou chybět přednášející z Brazílie, Indie, Austrálie, Německa, Číny či z Jižní Afriky a řady dalších zemí.
Ladies and gentlemen, welcome back in the hall number 2. Now it's my great honor to welcome Mrs. Miranda Ruchtie, President Marketing of the European Federation of Homeopathic Patients Associations, Board Member of Eurocam's Executive Committee, and long-time Policy Officer and Project Manager. The floor is now open for her presentation titled Patients Equal Power. Welcome. The floor is yours.
Thank you. Oh. Patience equals power. When patients lead, progress will follow. Every patient has the fundamental right to shape their own healthcare journey. Okay. Yet too often, these voices are missing, where it matters most, at the tables where policies are written, budgets are set, and systems are designed. You already got a brief introduction of myself. I'm Miranda Ruchtie. Since a year, I'm the President Marketing of the European Federation of Homeopathic Patients Association, and I'm also working now for 8 years for Eurocam, the platform for CAM modalities in Europe. And I also want to highlight 2 persons I work really closely with in the EFPA. That is Crystal Scaling-Klopstock. She is president for the international relations, and Annemieke Laan for the Dutch Patients Association, who is really dedicated to to bring the voice of the patients at the table. But why should you listen to us? Well, we need to get patients involved in all countries. EFPA has decades of experience in patients' work, advocacy work, and marketing and communications. We are 26 years old at the moment, not me, but the organization. And we have 22 members in 15 countries. Our important aims are support homeopathic patients groups in every country, European country and abroad, foster links in the TCIH field, and promote the positive aspects of homeopathy. We collaborate with on international and European level. That's the LMHI, ECH, that are the homeopathic doctors, and ECCH and ICH homeopathic practitioners. Furthermore, we work with WHO, Global Center for Traditional Medicine, Eurocam, eChamp, HRI, and the TCIH Coalition. We are all aware of homeopathy's challenges. We increasingly effective opposition in homeopathy, authorities ignoring research evidence and patient choice, and diminishing availability and access to medicines and practitioners. But what is needed to help shift this negative tide? Putting patients truly in the center and creating patients associations. Patients are our most valuable asset. Patients raise awareness, patients are funders, and patients are the strongest advocates. And that's almost always forgotten. Patients share experience. This leads to increased demands for homeopathy, a greater knowledge of homeopathy's potential, and a higher income for practitioners. You know, a patient's narrative is much more compelling to hear than a story from a practitioner or a scientific person, or academics. It's so important that the patient's voice will be heard and that their narratives are shared worldwide. A patient's funds. It's also that patients fundraise for projects and activities. Grateful patients leave gifts in wills. Patients can volunteer expertise, make personal connections to strengthen homeopathy. And for instance, the grateful patients leave gifts in wills. We have really good examples in the Netherlands. I will show later on how the Netherlands works. But they got really good leaves from wills. It's really high amounts, serious money where you can make a difference. And patients are the strongest advocates because patients are unbiased and not financially benefiting from homeopathy. Patients can speak up as voters, parents, and citizens, have professional and personal connections, allies in a fight for legitimacy and recognition. As an organized group, advocacy actions are far, far more powerful. And patients educate their community. You cannot educate the world alone. Your patients can. They reach their community, their family and friends, and they speak with passion about their experience as evidence. Harnessing the unique power of patients is critical to the resilience and growth of homeopathy and other TCIH modalities globally. And for me, it's really important to note that this is I'm talking here for EFPA, the Homeopathic Patients Association, but this is for all modalities, really important. And what we see is that at least in the European, on the European level, that the patients' associations are not that strong. And one of the strongest associations are the homeopathic patients' associations. So hopefully this is a lesson and advice to bring home and see if you can do more for your patients' association, patient groups. Harnessing the unique power of patients is critical to the resilience and growth of homeopathy and other TCH modalities globally. I want to give here a good example. It's the Dutch Homeopathy Patients Association. The managing director, Annemieke Laan, is really passionate and focusing on her strategy on communications and marketing to bring homeopathy and healthcare forward in the Netherlands. And she really goes from small roots to a large association. For instance, when she started in the Netherlands, she was asked for a really small salary to help the Homeopathy Association to grow. She went with bottles of wine, French wine, to all the industries, the Homeopathic Association, and they asked for support and help. And she managed to do that. She was really determined in that. But I will lead you to how she works. For instance, she started an Instagram strategy and her target audience are young women. And the key goals are raise awareness about homeopathy and promote training and education opportunities and recruit new members and promoting webinars. And they aim to reach 1 million consumers. And this is focused on the younger group, young women who get kids, have kids, and to get them to get in touch with them. On Facebook, they're informing about homeopathy. This is another group. This is an older group. And they inform there on science, news, and recruiting new members. And their reach is 5 million people per year. And also the website is focusing on the scientific research, informing about homeopathy. And what's really nice, there is also a searchable database where you can search for an homeopath in your neighborhood. And they reach 500,000 unique visitors each year. And they have every time different topics. So you can see it's about hay fever, and they follow the seasons or other important topics what they can use in their publicity. And what they also have is a homeopathy app. In the Netherlands, it's not allowed to have a description of the remedy on the package. So they thought about it, how they could help the consumer. So they decided to develop a homeopathy app. And in that app, you can scan the code on the package, and then they have all the information about the remedy. And it is really popular and works very well. And then they have the homeopathy magazine. Since this month, it's also digital. It's not only you can ask for a digital version, and it's full of information. The same as but online, but here are also patient stories and interviews. Patience equals power. Patients are the movement. We need them to bring homeopathy further. We can ask constantly doctors and practitioners and everyone in our community to bring homeopathy further. But we have seen for decades now, we need to do it in another way. And we need to focus on what the patients can do for us and listen to what they want. And I want to ask you to be part of the movement, that we need to do it together. We need to educate our patients. We need to skill them with advocacy tools. We need to inform them which message they could bring for us, and then they can work for us and bring homeopathy further. For instance, we will start now also a platform where we will share video testimonials from patients. We will start in Europe and slowly start to do it international. And we will keep it low key. That will mean that we ask patients to make a video with their phone, make it not too designed or whatever, and do it in their own language and tell in 1 minute about why they are so passionate about the treatment with homeopathy. And to build something powerful, patients, practitioners, and industry, we need together, and we have to listen to the patient as well. Quick takeaways: patients' associations are powerful. If you don't have a patient association in your country, you should consider how you can create one. Working collaboratively with patients and creating a patient group can be an incredible positive step in making homeopathy more robust in your country. If you do have a patient association in your country, please get involved. And we also see now in the different countries that they try to set up a patient group of a patient association, but it is not that easy, because you can, as a practitioner, you can be really enthusiastic about that idea, but you need to find patients who have the time, the skills to set up a patients association. So what we're trying now to help the practitioners to find people who can do that for them and advise them. We do that with in Zoom meetings on a regular basis, and so we try to do everything to get them involved, because sometimes they have financial support, because that's another thing. It costs money to start a patient group or association, but they don't have the people available. And on the other hand, there is also a country who don't has the money available, but they have some person who can do it. But what they did, for instance, was that they work now closely together with another chem modality group. And if you combine them and try to share then and start from that point a patients association, then at least you start something. So if you need any assistance or any questions, don't hesitate to reach out to EFPA. These are our email addresses, and I have a leaflet there in front. So I don't know if someone has a question.
Hello. I would like to ask myself, how can patient involvement help overcome skepticism and improve recognition of TCM and CAM therapies among policymakers and publics from your point of view?
Yeah, well, skeptical people are always difficult, but it's really important when you determined and enthusiastic and can explain the results of your treatment and how life-changing it is, then people will see it and they will change their minds. But last time on a Dutch television there was a member of the European Parliament, and they said we have always the pharmaceutical industry at our table. Every time in a week, every day, they are there and they want to speak with us. There is no civil society patients who are at our table. And we understand that they don't have the money, but we need to hear their voice. So, I know there is a financial struggle as well. EFPA works on a voluntary base. And, we work really, really, really hard. And it is Thomas who gives us the opportunity. He pays for my hotel accommodation and part of my travel expenses that I could come here. But we do it on a voluntary base. So we need every time find someone who can help us to bring our message to you. And it's so important that you will get involved, that you help us. And I understand that it's not always that easy and that you don't have a solution now at this moment. But please take our leaflet, think about it, and you can always send us a message. Yeah.
Hi. Hello. Thanks for the presentation. I look at a lot of clinical research, and I have come across the occasional research in homeopathy, but I also noticed stuff being pulled from journals. Is it something that you see in the industry where it's difficult to have the clinical studies published in various databases of journals?
No, I'm not aware of that. Yeah, I hear sometimes things about it, but I can't really answer this question. But maybe there's someone else who can give some input on that? No. But still then, and what another development what we see is the citizen science and collecting good practice. Because that's also, if you do it in the correct way, that's all, we can present that also to politicians. Are there other questions or suggestions?
I say only a word of thanks. Thank you.
What?
Only a word of thanks. Thank you.
You're welcome.
I think it's worthwhile that patients have the possibility to learn what is the different homeopathical medicinal products are for. However, since I try to pursue the classical part of homeopathy, sometimes for patients it may be misleading because they think, oh, this remedy is for this and this is for that. How can you prescribe this for a totally different situation? So I think it's good to teach the public. On the other hand, it should always be made clear that this is just one part. And I recommend very much to use homeopathy in acute situations for emergencies. This is very easy. But especially for chronic cases, I think the public should be aware that this is not only possible. But otherwise, you are correct, and maybe we should also start a patients' association in Austria.
Okay, thank you. And I agree with you, but I want to add something. At the Dutch Patients Association, they have every year an homeopathy festival, and there you can subscribe for a short homeopathic consult. It's for free. It's online. It's only, I think, 15 minutes. But what is important there, that people get more familiar with homeopathy, and they always someone will come with a specific topic, and then they explain how homeopathy works, and that they can make an appointment because they need a longer consult to prescribe a remedy. So and that is really popular in the Netherlands at the moment as well. And we see that people who subscribe for such a short consult, that they ask that they will look for a practitioner or a homeopathic doctor to ask for a real consult. So, but I understand your problem with over-the-counter remedies, but we need something to get people familiar with homeopathy. Yeah.
Miranda, have you some members here of the Czech
Patients Association of
the Czech organization, patients organization?
No.
Czech homeopathic.
No. But we have. There are my colleagues from the ECCH here, and from the ECH. These are here, but not from Patients Association. No.
But you have members here in Czech.
No, we haven't. So we need to start as well.
Haven't?
Yeah.
So this could be a moment.
Yeah.
Okay.
Yeah. But I'm really stubborn and determined to broaden, so and I'm still here.
Hello. Thank you for your presentation. It was very nice. I want to ask, you are collecting this patient data to publish somewhere in as a evidence, or it's just for awareness of homeopathy?
No, we don't collect data because that's not what the Patients Association does at the moment. But what I am promoting that all the other the ECH, ECH, LMHI, ICH, that they and UNME, that they start working on how to collect data and to bring that on the table. But this is a scientific project, yeah.
Yeah, so there's a. Do you have anyone in India also?
What do you have?
Do you have your project in India also?
No.
Okay. In India, there is one website. There was a question of clinical evidence.
Mm-hmm.
So there is one government website where homeopaths can publish their cases, successful cases, and it is checked by government, and then they can publish their successful cases on this website.
Okay.
Yeah.
Thank you.
Thank you so much.
Are there other questions? Okay. My email address is miranda@fpa.eu, and I'm really curious how many emails I have in my mailbox on Monday with advice, with ways to how we can connect and how we start a patient group. Okay? Thank you so much.
We thank Mrs. Miranda Ruchtie for her inspiring presentation. Thank you very much. And now, ladies and gentlemen, unfortunately, our next speaker in this sync, whose presentation was planned at 1:15, is unfortunately cancelled because he's not present. So we continue with our program in this hall number 2 at 1:30 with next speaker. Thank you very much.
Good afternoon, ladies and gentlemen. It is my great pleasure to welcome back Professor Michael Frass, Professor Emeritus of Medicine at the Medical University of Vienna, renowned for his leadership in clinical oncology and integrative cancer care, Chair of WISHOM and President of the Austrian Umbrella Association for Medical Holistic Medicine. Please welcome.
So, good afternoon. I hope you enjoyed lunch as I did. And we will talk now about a study which, or some studies I've published about homeopathy and cancer. In all these studies, homeopathy was used in addition to conventional medicine, was not instead of. The first study is a retrospective one, which focuses on the survival time in tumor patients. The second one is a pragmatic study investigating the influence of additive homeopathy on quality of life. And the third one is a double-blind study comparing or investigating not only quality of life, but also survival. The first one is a reanalysis of survival data of cancer patients, patients who are utilizing homeopathic medicines. And the nice result is if you use a special method, which is called landmarks, then if a patient starts either 6 or 12 months after diagnosis, there's still a positive, significant effect of homeopathy in those patients. And the second one is a study on the influence of homeopathic medicine on global health status and subjective well-being. It's a pragmatic, randomized, open, controlled study. So it's a real-world study, what's happening in the real world. And this was done at the outpatient unit at the Medical University of Vienna. I was serving there for 15 years, from 2004 to 2019. My boss was at this time the top oncologist of Vienna, Professor Zielinski. And all those patients were treated conventionally by help of chemotherapy, radiation, and or surgery. And patients could ask for additive homeopathy, and there were about 600 patients contacts per year. This was a prospective controlled study. It was randomized. About 200 patients, not only about, but 200 patients received conventional treatment, while 200 patients were additively treated by individualized homeopathy, which means it takes about 1 hour to take the history, and no placebo was used in the control group, so it was a real-world study. If you look to the patient's characteristics, the baseline characteristics were comparable. Also, the different types of cancer were comparable, and also the metastatic disease, as well as the percentage of chemotherapy and or radiation therapy in those patients. And if you look to the results, I think it's not easy to look at, but you know I'm a little bit older, so I don't have these nice slides. If you look to the left bar, it's the homeopathic group. Yeah. And there was an improvement of the global health status as well as the subjective well-being in those patients. In addition, also the functional parameters as well as fatigue improved in the homeopathic group, and also pain and dyspnea improved, while only diarrhea deteriorated. In the second part, the control group, there was an improvement in subjective well-being during the course of 18 weeks. That was a deterioration in physical functioning, an improvement in role functioning, a deterioration in nausea, vomiting, and pain, and also with respect to constipation, diarrhea, and appetite loss. Now, if you compare this difference within the 18 weeks between control group and homeopathic group, you look to the right third of this table, which shows that the homeopathic group was significantly better than the control group with respect to subjective well-being and global health status. Also with respect to all the functioning parameters and fatigue, and also with respect to dyspnea and pain, as well as appetite loss. So in conclusion, this was the first prospective control study evaluating additive homeopathy at the same center. You know, Dr. Rostock, he has investigated 2 groups, but those patients were treated in 2 different centers. And global health status and subjective well-being of cancer patients improved significantly with homeopathy. And this study was included into the German S3 guideline, which is used for complementary medicine during treatment of oncological patients. And there it is at least a so-called can indication. So you can do it without being punished. Now, the next study, which is the largest one, and it lasted for about 10 years from the beginning to the end and publication of the study. This was a 3-armed study. It was double-blind, prospective, randomized, and multi-center, and was published in a conventional journal, The Oncologist, in the year 2020. Since limited options for patients with advanced non-small lung cancer, we thought that additive homeopathy might help to alleviate the side effects of conventional therapy, and therefore we investigated not only the quality of life, but also survival in those patients. Now we have 3 groups. The upper group is the homeopathy group, which received conventional treatment and in addition double-blind individualized homeopathic remedies. The second group, with 47 patients, received conventional treatment plus placebo. So altogether there were 98 patients who were randomized and evaluated with regard to quality of life and survival. The third group, the control group, we have included because it could have been, if there's no difference between the first 2 groups, that my suggestion and my placebo Wirkung might have added to this effect. Unfortunately, this effect of placebo doesn't work with my bank account, for example. I don't understand. So this control group were patients only with receiving conventional therapy, and those were evaluated only with respect to survival. And these patients never have seen the homeopath. So the choice of remedies was done in a classical way with help of repertorization. And then when we've finally decided to use a special remedy or homeopathic medicinal product, as it is called now in English terms, then we sent either a fax or an email to the pharmacy. Now, the pharmacy used a very special randomizer program, which automatically writes a protocol. So it's not as a usual randomization program, but it automatically writes each patient who is included or excluded of this study. And then the homeopathic remedies were sent by help of mail to the patients, so even the pharmacist could not have any influence on the patient because he didn't or she didn't see him. And every 9 weeks there was a follow-up, and patients were completing questionnaires, which they had to do in the basic before the study, and there was a follow-up history taking, and now we decided to either continue or to change the medication. Now, the characteristics are comparable. They were even a little bit more or worse lymph node status in the homeopathic group, but this was against the homeopathic groups. And if you look to the life quality and the functions scales after 9 and 18 weeks, there was a significant improvement in the homeopathic group versus the placebo group. And also the symptom scales improved significantly after 9 and 18 weeks in the homeopathic group. Now, this would not have been a big problem for all of the conventional doctors. However, the real problem was the homeopathic patients lived longer, and this caused a lot of turmoil, because as you can see on the green bar is the homeopathic group, and those patients lived for 435 days versus the placebo group with 257, and versus the control group living for 228 days after diagnosis. So it's about 6 months difference between homeopathic group and the placebo group, and only 1 month difference between placebo and control group. So my placebo effect is only 1 month. So if you spend time together with me, you will live 1 month longer, but not much more. And, this interesting finding could also be shown in this Kaplan-Meier curve. And we believe that this study is at least a hint that not only quality of life, but also survival improves in patients suffering from non-small lung cancer. In addition, opposite to many other studies which I have read, we had to include the patient within 8 weeks. This was the result of our first mistake. I showed you in the beginning, it would last a little bit too long to talk about this late entry problem. And I think in addition, we had another evaluation or assessment way, because the planning statistician did not make the final assessment. In between, all the data by a special clearing process had to brought out of the General Hospital of Vienna, and another statistician, she had to assess this data. So there's no possible influence possible. There's no influence possible by the researchers. So I thank you for your attention. And just 34 years ago, there was a young gentleman, Professor Dr. Pavel Dusinski, who's from the University of Prague. He's just sitting in the first row. And he spent a lot of time together in Vienna. And now he is a famous doctor in your country. And I'm proud to be a friend of him. Thank you so much.
Just introduce. Yes. Okay. Thank you very much for your inspiring presentation. And now it is my great honor to welcome Mr. Mark Taylor, CEO and founder of Patient-Led Oncology in the United Kingdom, a visionary leader bridging integrative oncology, energy healing, and trauma therapy. Please welcome. The floor is yours.
Thank you. Hi, everyone. I run an organization called Patient-Led Oncology. Where's the clicky thing? And I'm not a doctor in any way, so it started with me getting a cancer scare. I had positive circulating tumor cells, an inconclusive biopsy, and the genetic analysis was correlating with pancreatic cancer. because it was not a confirmed biopsy, I wasn't eligible for standard of care, and a surgeon took me aside and said, off the record, I recommend you look into alternative medicine, but don't tell anyone I told you this. So I was a skeptic at the start. I came from a finance background, very mathematical, and I started looking into the world of alternative medicine, but was lost and I had no one to guide me. And I started a research of seeing a number of doctors around the world, and it was working. My tumor markers would fall, my CTCs would fall, and it kept coming back. And then I'd go to another doctor, and it kept coming back, and it went to another doctor, and it kept coming back. And along the way, I started realizing by the 10th doctor, I was educating the 10th doctor on what the other 9 doctors were giving me. So I thought there's a gap here. They're not keeping up to date with the research. And it's really with a business background, I realized there was a mathematical opportunity in the gap between what's in standard of care and medical research doubling every 3 months, which is now confirmed. So we're trying to close the gap between what standard of care are doing and what research is being published. So I created a research organization. It's me and my partner, Gabriel Gavassi. We're both mathematicians by background, sort of problem solvers. We took a mathematical approach to solving it. And we have 2 PhD researchers, Dr. Jahan and Dr. Sahil, who work for us as well. And we look at cancer research through 4 lenses. One is my own experience. I self-study from a medical side, but also increasingly into the psycho-spiritual, very alternative world. I have a Facebook group with 7,300 members, and we're all sharing information on what we're doing. And then I started selling research to doctors and healers who work with me, and we collectively share information together. So I share the research into them, and then I get to follow their patients, and they give the information back to me. But increasingly what we realized is almost everything is in clinical research, and we just basically spend most of our week looking at clinical research that's published, and it's coming at a week of around 50 research articles a week that we filter through, and we're probably at 10 which are relevant for patients that they can take advantage of. So it's a real-time process. It's quite difficult actually keeping on top of the research that's available. This is one of our clients. He's quite a prolific inventor, doctor in the US, Dr. Onik. He invented the nanoknife and cryoablation for prostate cancer. It's one of our clients. He invented a procedure by making an in situ vaccine, a 1 centimeter cryo ball in a prostate tumor with immunotherapy agents, and he's clearing prostate cancer in 47% of the patients. And this is an experimental treatment. So prostate cancer, a metastatic disease, is now a hopeful disease if you know where to go. And we do research for him. And this is a sort of, so he's published his research as retrospective, and it's now in clinical studies and doing, he's got a 100% response rate actually in the stage 1 clinical trial. And then another side of my research is I explore experimental healers. So this is me talking to the shaman of the Noki Khoi tribe, and I went to go and interview him about how he treats cancer patients in the Amazon. And as a stroke of luck, the translator's mum had been treated by him for cancer. And they went through the process of what they used in terms of ayahuasca, cambo, which is a toxic frog in the jungle, and some herbs from the Amazon. And he managed to clear her cancer. And then what I do is I look back through the research and go and find out, is there anything else that correlates with that? And you will find case reports of the use of cambo. And it's a similar process, the purging process used in Ayurveda. In a lot of my research, I come full circle. It seems that kind of a lot of medical traditions, certainly in the ancient, original, indigenous medicines, have the same concepts. They just have different terminology and different methods to do it. So what we've done is we created a database of 2,500 studies that your oncologist won't tell you about. So these are all the studies that you can take advantage of, a patient that is not in standard of care, and it's growing at about 10 per week. I didn't know about the homeopathy one, so I've got an extra one to add in. I've sent to my research team to add into next month's version. And you can go online, you can search for it. There's a free version for patients with some basic stuff, and then there's a $19.99 one, which is more aimed at doctors. And these are an example of things, you know, the power of what's actually happening. If you follow the research, we're getting very close to very effective treatments at the edges of oncology. So for breast cancer now, a very simple combination of 2 drugs, hydroxychloroquine and everolimus, an mTOR inhibitor, is for patients who've had surgery with breast cancer, it's clearing all the dormant cells and stopping the cancer coming back after 3 years of following. So, and typically it will come back in that cohort in about 7% of patients. And this is something that's quite easy to do, relatively safe, and for an experimental hospital that can give it, you're almost guaranteed for the cancer not to come back, at least in the short term from the length of the study. Cancer vaccines are a big trend in all early studies. They're showing excellent results in stopping the cancer come back. And then we have access to a lot of clinics that use these cancer vaccines where they can in certain less regulated environments. And then so that's, it's typically a private world. Some of those treatments are relatively expensive, but there are also some very cheap treatments out there. So oral bicarbonate for pancreatic cancer patients, when you could shift the urine pH to above 7.5, people were living 29 months versus 8 months of a pH of 6.5. So it's not only for people with money, but there are some very effective solutions that people don't know about at the cheaper end. And at the website, we go through basically every single treatment, and we look at treatments that can help your outcome, treatments that can reduce the risk of side effects, and dosing adjustments as well. The dosing adjustment is probably one of the most important for the future of oncology, because we had the realization from our research that there are financial incentives for the pharma companies not to dose at the optimal levels, particularly when combinations are used. And that will be a final slide I'll talk about. And this is the conclusion we came to. We wanted a single slide to represent what was the future of oncology. This is the edge of oncology as we see it. It's super complicated, but it's everything we can see that's working, based around the hypothesis that it's the immune system that's going to clear up the cancer. So there's an assumption there. It goes from meditation techniques to naturopathy ideas, coaching ideas, just in terms of what a patient needs to do to get themselves kind of organized. Like we got one called starting early. The professor highlighted the point about homeopathy only working when it was started early. This is a key point we see with a lot of people who enter this world, is it doesn't work so well when you enter very late. So yeah, on the outskirts, there's 4 key components: treatment strategies to do with dosing combinations, rotating drugs, inner work, fundamentals, which is kind of your typical naturopathy, and concepts that the patient needs to take on board themselves. Something called the circle of immunotherapy. When you do immunotherapy, it's not a question of a single drug. It's a multifactorial thing. You need 8 segments to be in place at the same time for it to work. And this is why immunotherapy only works in a small number of patients today. But if you look at the clinical studies, when you start adding all these aspects in, you start breaking down the problem like a math problem. So, the common one I talked about earlier is cancer vaccines. So it's a lot of cancers do not respond to immunotherapy because the immune system cannot recognize the cancer. And this is tackled with cancer vaccines, and that will start coming through into standard medicine in probably the next 10 to 15 years. But you can get these privately if you look. And there are other mechanisms to vaccinate the body against cancer as well. And then these are kind of your traditional treatments with some other things with evidence to treat cancer. The realization in this was, when you look at the research, if you assume the immune system is there to clean up the cancer, in some cases today the dosing levels used destroy the immune system, and this is known. Where if you look at the studies, if you move to more regular, lower dosing, it can work in synergy with the immune system. And this is one sort of really important point that patients need to realize early, because if you want the best outcomes, you need to be aware of this before your immune system is damaged. And now in the private world, testing on the tumor can be done on almost everything. Every aspect of the microenvironment, the genetics, the sensitivity to off-label drugs, the likely response to immunotherapy, the likely response to TKIs. You can get a huge amount of information about your tumor through testing in the private market that you won't get in standard medicine. Likewise, on sensitivity testing, you can test various substances against the tumor, even in combination at different dosing. And then this is what we come up with for, in our opinion, from the latest research, in an example of the optimal way to treat cancer. Now, this doesn't include the mind-body approaches, which are kind of fundamental as well. The emotional side of cancer is incredibly important. But the concept, actually, the way we see it and the way we discuss it is more like a Chinese medicine approach to oncology. And it's using the oncology drugs at very minor dosing, non-toxic dosing in many cases, but in combination. And we've got some very good cases of these type of things used in a non-toxic way, where the patients, this is a big example of one patient who's been writing a book through treatment and responding very well. And then this highlights 2 points. One is, we've called it the end game. It's meant to be controversial to spark debate. We're not saying it's a cure for cancer, but what we're saying is, It's what we're seeing as the frontier, and we're asking patients, doctors, researchers to help us update it as we go along. So this is version 0.4, the earlier version was 0.7. We're constantly iterating it as we learn, and there's new research coming in all the time. So it's a process, and the end game is, the intention is to be, how do we stay on top of the research and publish the latest research as it comes out? And this is, for those that can't afford these private doctors to get this private medicine, the impact of the mind-body is huge in cancer. And if you break down what we've called the circle of immunotherapy, there are studies in all these orange items where the emotional state impacts the mechanism. And what it's kind of indicating is the microenvironment of the tumor is shifted from the emotional state of the person. And it's as if you're getting access to dozens, if not 30 or 40 medicines in simultaneous methods through shifting the emotional state. And I have case reports of seeing people who have been able to shift their emotional state and in some cases at least reduce the cancer, and in some cases get rid of the cancer. It's very rare. I work with patients and people trying various approaches. It's very difficult, but we do see cases, particularly when people have had, say, surgery and signs that the cancer is coming back and the markers are increasing, when they start working out how to meditate, maybe doing a psychedelic experience, and they can shift the emotional state, quite often you can see the markers starting to fall again. So this is a summary. This is where we see the future. It's a combination of the latest research in integrative oncology and innate healing.
Thank you very much for your inspiring presentation. And as we still have some time allotted, I would like to kindly ask the audience if there are any questions.
Okay, still not. Yes, very good. Can you hear me? Yeah, I can. So, have you approached mainstream medicine with this integrative approach? It seems to be very holistic, very integrative of many different elements. I love it. It's a bird's eye view that you presented very well. But have you approached mainstream medicine with this? And if yes, what is their response to it?
I've tried in a couple of instances, and I got sidewalled. It's too difficult, I think, to enter as a topic. I mean, I comprehend the difficulties of changing standard medicine, which is a standard that's available across 150 countries. It's not a simple process to change and integrate these ideas. I'm presenting at conferences, and people are listening, and I'm starting to get uptake on some conventional people. But not yet. I mean, I think it's going to be a slow process, but well, actually, I correct that. I'm working with a bunch of American entrepreneurs and an American hospital that's an academic institution, and they understand the concepts, and they're working through the practical implications of how to add it, but it's very early stage. And I believe there's a couple of twins that are oncologists in the US, and they're dialoguing about it, talking about it. Their mum died of cancer, and they're also talking about the problem, because it's not really a medical problem now, it's a system problem. How do you know, the evidence is not there yet. How do you run a clinical trial? How do you fund it? It needs thinking, you know, and I haven't done enough thinking yet to solve that problem, and I think it needs people in the system to understand how do you bring all this in to shift the system.
Thank you.
No worries.
If there are no more questions, I would like to thank you very much, Mark Taylor. Ladies and gentlemen, we will take a short break between lectures, and I look forward to seeing you back at 2:30 p.m. Thank you very much.
Rady odborníků, příběhy s inspirativní filozofií, četba, výstavy, dokumenty z cest i relaxace, pohlazení pro tělo i duši, radioregenerace CZ.
Záhady života. Časopis o mystériích zdraví a duši.
Bude to radost, bude to mejdan. Český mejdan s impulzem. Skvělou zábavu vám přeje
Zdraví nezná hranic. Hledejme, co nás spojuje. Je čas začít spolupracovat. Takové je motto letošního Mezinárodního kongresu zdraví, který se ve dnech 3. až 5. října uskuteční v Praze. Je určený pro profesionály i laiky, kteří si chtějí rozšířit obzory v oblasti tradiční komplementární i integrativní medicíny i medicíny založené na důkazech. Zapojit se lze osobně i zdarma online. Loni tak Mezinárodní kongres zdraví sledovali 2000 lidí z 55 zemí. Letos organizátoři slibují informace od předních odborníků z americké Cornellovy univerzity, z britské Cambridge a nebudou chybět přednášející z Brazílie, Indie, Austrálie, Německa, Číny či z Jižní Afriky a řady dalších zemí.
Good afternoon, ladies and gentlemen. It is my great honor to welcome Ms. Nicky Pawan Kaur, founder and CEO of Chandigarh Spinal Rehab, distinguished leader in holistic neurorehabilitation, Golden Sachs 10,000 Women alumna, and highly acclaimed advocate restoring mobility, dignity, and hope to thousands. Please welcome.
Hello. Yeah. It is a great pleasure and an honor to present our work at this Congress. And so I would just like to say that why are we even here? So we are here because we would like to introduce a new concept of rehabilitation that we have adopted in India for people with brain injuries and spinal cord injuries. So when we started this journey, what was happening in the space of rehabilitation was physical therapy, occupational therapy, and some living skills on the wheelchair. But what we decided was to make it a comprehensive rehabilitation model, because mostly when one is looking at rehabilitation, they think of the body because it is broken, it is paralyzed because of either stroke or an injury or some kind of a trauma to the brain. And then they think that this is what is the injured part, the body. But we look at the spiritual body, the emotional body, the mental body, and then the physical body in India. And this is the way we look at the human over there. So we say that if the body is broken, and we are laying emphasis on the other parameters of the human, that is the spiritual, the emotional, the mental, then the physical automatically gets empowered when we empower at all levels. So we started by focusing on the individual, because very often in India, a paralysis, a stroke, or an injury leaves a person not just broken physically, but broken emotionally, because if you know, I'm sure all of you know here about spinal cord injury, the amount of care and nursing that is required for spinal cord injury by the caregivers is very intense. And it's a long journey of caring. So very often, the best of relations fall apart. So the person becomes emotionally battered. So where we are talking about the body being broken, even the spirits, the emotions are battered. And beyond that, the financial resources are also very often drained. Because while the West has a lot of subsidized healthcare, in India, unfortunately, we do not have even insurance cover, and we do not have subsidized healthcare. So the person is broken even financially. So families get drained out financially a great deal by the time they come here. So it is very important for us in the process of rehabilitation to empower the individual to such an extent that he can go out and live a life of dignity, of self-dependence, and take charge of his life, really, in every which way possible. So this is a journey of rehabilitation, a journey of empowerment, a journey of building resilience and self-confidence, and a journey of finding himself or herself and coming on top of life. Because very often we think when a person is battling a disease or an injury, what helps the person come out of it is the medical treatment. But a great deal we found, along with the medical treatment, is the inner power, the inner growth, and the inner strength that can be found. And when it is found, healing happens. Healing happens more comprehensively and at greater levels. So we wanted to share with you a small glimpse of our work where we look at patients on wheelchairs and patients with paralysis, and we think, oh, that center must be very heavy on energy, or it must be a very boring place. But we don't make our center like that. It's a rehabilitation center, but a center where we do not want the individuals who have come here to just get a physical rehabilitation and go back home. We want them to find themselves and to be able to live a life of excellence, not just existence. So we feel that for a person to find himself and to live his best life, despite the accident, despite the trauma, is the essence of the journey. So we wanted to share a small glimpse of our work where we bring joy to their lives, and we try to bring, to help people find themselves in this particular way that we are talking about, of comprehensive and holistic rehabilitation. So there's a small video which will give you a glimpse of our work. Thank you.
I never imagined I would be able to walk again. People told me I would never drive again. I never thought I would swim. I could never dream of flying one day. For someone with a spinal cord or brain injury, it's not just a movement that's lost. It's freedom, confidence, even identity.
Spinal cord injury is a life-changing event. 10 years, 15 years ago, when we didn't have any rehab, it was very tough. Patients would get surgery done and they would just lie down. Even after surgery, they didn't know what to do. They would just completely lie down, get bed sores. And the life of a quadriplegic means who's lost his fingers and the lower limb. I mean, in India, it was like less than a year. The rehab is an important step in getting back into society productively. So we have a Chandigarh Rehab Center, which is Sector 26, which is doing a remarkable job, and we send our patients there who cannot afford too much.
People stop seeing the person, they only see disability. But here, we see something different. At Chandigarh Spinal Rehab, we see the divine spark no injury can extinguish. The smile waiting to return. The dreams that never left. This is where strength is rebuilt, not just in muscles, but in spirit, where every small victory is celebrated. A lifted arm, a first independent transfer, a wheelchair rolling towards the sunlight.
So yeah, quite a few of my patients who have opted to go to the Chandigarh Spinal Rehabilitation, I've seen quite good results. I can remember very severely affected stroke patients who had almost all 4 limbs paralyzed. And I'm really glad to see that he has reached a state of functional independence. But if good rehabilitation is given, it is very heartening to see they are able to earn from themselves, they are able to carry out a livelihood, they are able to carry a job, which I think is marvelous.
Here, an accident is never the end. It's the beginning of a new story. One of courage, resilience, and a life lived without limits. Because we believe every person has the power to rise again. And together, we make that happen.
मेरा नाम विद्या है। मैं बिहार के एक छोटे से गांव समस्तीपुर डिस्ट्रिक्ट से हूं। आज से 15 साल पहले साइकिल से गिरने की वजह से मेरी रीढ़ की हड्डी टूट गई और मेरी आधी बॉडी पैरालाइज्ड हो गई। मैं बेड पे रहने लगी, पूरी तरह से फैमिली पे डिपेंड हो गई। लोगों के ताने सुन के अपने जीवन से बहुत दुखी रहती और परमात्मा से यही प्रार्थना करती, या तो मुझे अपने पास बुला लो या सही रास्ता लगा दो। 11 साल बाद भगवान ने मेरी सुन ली। मुझे चंडीगढ़ स्पाइनल रिहैब ने अपने पास बुलाया, मेरे बेडसोर की सर्जरी करवाई। उसके बाद मेरा रिहैबिलिटेशन कराकर मुझे पूरी तरह से इंडिपेंडेंट बनाया, मुझे जीने की एक नई दिशा दी। मैंने कई सारे स्पोर्ट्स खेले, स्विमिंग, लॉन टेनिस, और मैं टेबल टेनिस नेशनल प्लेयर हूँ। मैंने फैशन शो भी किया। अब मैं स्विगी में डिलीवरी करती हूँ, खुद कमा रही हूँ और आत्मसम्मान के साथ जी रही हूँ।
We have seen what happens when you believe in possibility. We have watched people arrive here broken by the body, by lack of money, by the silence of family and friends who drifted away. We have watched them find new strength, new skills, new reasons to wake up in the morning.
मैं अकेले गाड़ी में था, तो मैं ड्राइव कर रहा था, तो रात को करीब 2 बजे के करीब तो मुझे नींद की झपकी आई और मेरी गाड़ी पहाड़ से नीचे गिर गई। डॉक्टर ने कहा कि घर में ही देखभाल होनी चाहिए, कोई इलाज नहीं है इसका। तो मैं बेड पे ही था, मतलब कुछ हिल नहीं पाता था, कुछ कर नहीं पाता था। मेरे गले में ट्रिकोस्मी लगी थी, वहीं से मुझे पानी वगैरह, जूस, दूध वगैरह वहीं से गले से ही दिया जाता था, प्रोटीन वगैरह।
हमारा जो गांव है वो बहुत मतलब पहाड़ी एरिया है, और जब इसको हॉस्पिटल ले जाना था 4-5 आदमियों को इकट्ठा करके बेड पे ले आना पड़ता था।
बेड सोर भी हो गए थे मेरे को, जख्म भी हो गए थे। फिर मुझे चंडीगढ़ स्पाइनल रिहैब के बारे में पता चला, ऑनलाइन पता चला यहाँ के बारे में।
He was having around I think more than 10 pressure injuries all over the body, and the depth of the injuries are also high. So I told the CEO, see, if we are taking this particular person in as a patient for rehabilitation, then you should be blocking one bed for a year. Turned out to be he got rehabilitated in 7 months successfully.
मेरी गले में जो ट्रिकोस्मी लगी थी वो भी हटाई गई यहाँ पे, और यहाँ आने के बाद ऐसा लगता है कि मैं अब कुछ कर पाऊँगा आगे।
यहाँ इलाज हुआ तो उम्मीद जगी, इसके जीने की जो उम्मीद जगी यहीं आके जगी है।
जब मैं यहाँ पर आया तो उसके बाद मेरी एक्सरसाइज शुरू हुई। मैं धीरे धीरे फिर मेरी बाजू सीधी हुई, फिर एक्सरसाइज हुई, और उसके बाद फिर ये वाली मोटराइज व्हीलचेयर सिखाई गई मुझे। ये भी मुझे चंडीगढ़ स्पाइनल रिहैब में यहीं से मिली है। अभी चेस भी खेलता हूँ मैं। आगे जाके अब कुछ करना चाहता हूँ मैं, गेमिंग में अभी गेम वगैरह खेलना चाहता हूँ।
We started playing the chess, and he started understanding the rules by looking the game between me and somebody else, and then he started playing, and he beat me half the time when and I beat him half the time. So he is up to my level.
We train in the real world because the real world doesn't have padded walls and perfect ramps. We teach you how to get up when you fall, how to move through a crowd and claim your space, how to drive a car that wasn't built for you.
I've had a stroke 3 years ago. Coming 5 days a week to Chandigarh Spinal Rehab to help me get my balance back, my leg work, which is I've got a left side paralysis. The physiotherapist teams are the top service providers that I've seen, even being in the UK and comparing it to here. I want to thank Chandigarh Spinal Rehab so much, being a family and being so supportive and caring.
We believe in pushing limits because limits shrink the soul. So we play, we swim, we race, we trek, we try things the old version of you would have called impossible. Yes, we have numbers, hundreds rehabilitated, over 80% back to independent lives, almost half treated free of cost.
मेरा ट्रैक्टर से एक्सीडेंट हो गया। दिल्ली में मुझे स्पाइनल कॉर्ड इंजरी का ऑपरेशन हुआ। 6 साल पानी के मैं बेड पे रहता था। हम बहुत रो रहे थे कि अभी दुनिया में हम जिंदा नहीं रहेंगे, मर जाएंगे। हमको चंडीगढ़ रिहैब का पता दिए, मैंने वहाँ पहुँचा। 6 साल का बेड सू 15 से 20 दिन में ठीक कर दिए। सबसे बड़ी बात है कि वहाँ इलाज में मुझे एक पैसा नहीं लगा, वहाँ से एक व्हीलचेयर भी मिला, और मेरा रिहैब इतना अच्छा से स्टार्ट हुआ कि हम 3 से 4 महीना में घर आने के लायक हो गए, अपने जीवन में कुछ कमाने के लायक हो गए, और बाल बच्चे के लिए 2-4 पैसा कमा भी लेता हूँ।
At Chandigarh Spinal Rehab, we believe in going beyond rehabilitation to building the quality of life, the will to fulfill one's destiny. And sometimes, destiny takes the shape of love. Rahul and Anamika's love story is one such epic moment when his family stood against their union. The center chose to play Cupid and arranged for their wedding. That day was more than a wedding. It was a promise that rehabilitation is about living fully, fearlessly, and with joy.
Thank you so much for your moving lecture. We are honored to welcome Dr. Pratibha Shah, internationally acclaimed Ayurveda expert, founder and president of the Global Council for Ayurveda Research, and a recognized leader whose pioneering work has been honored by the White House and the U.S. Department of Health and Human Services. Please welcome.
Good afternoon, everyone. Is this okay? Okay. Good afternoon, everybody. That was such a moving presentation. Thank you for that. So I'm going to share with all of you immunity applied concepts, bringing traditional and contemporary health practices together. So immunity is a big part of prevention as well as health, treatment as well. So it is an important topic, and I would like to share with you some of the classical concepts of immunity in Ayurveda. And before that, I will just provide a quick overview of understanding what immunity is, and empirical evidence showing direct relationship between these applied concepts and status of immunity as we currently understand it, and some closing reflections. So what is the immune system? What does it do in our body? The immune system's job is to help identify, resist, and eliminate dangerous germs that enter the body before they can cause disease or damage. So even as you and I, we are sitting here, there are a number of microbes that we are breathing in, that we are being surrounded by, and our immune system is taking care as our defense ministry, like an army 24/7, protecting us from invasion, because that's the law of nature that every species, every organism tries to survive. So when our defense is low, they will invade us, they will multiply, and they will cause disease. So our immune system is the one that takes care of protecting us. Immunity can also be defined as the balanced state of multicellular organisms having adequate biological defenses to fight infection, disease, or other unwanted biological invasions, while also having adequate tolerance to avoid allergy, so allergens, and also thereby preventing also autoimmune diseases. So it's both ways, when to raise that defense mechanism and when not to do it, so that we are also able to tolerate certain things around us, right? It has to be a balance. We cannot be reacting to everything. We are surrounded by a lot of things, and we need to tolerate and coexist with some of them. And the others that can cause disease, we need to make sure we are blocking their entrance as well as multiplication. And yeah, so this is what I was talking about. Every creature in the universe is a predator for some and a prey for others. And each living being has its own protection gear, physical as well as physiological. And it is a system that is 24/7 on. It cannot be off. So let us see what immunity looks like. So immunity can be of two types, adaptive as well as innate. So innate, as the word says, is that is within us, right? So like our skin, which is a physical barrier, or our white blood cells, this is already inside us. Adaptive immunity is what ensues when we introduce a particle, an antigen in the form of a vaccine or something else. So that would be adaptive immunity. And adaptive can be natural and artificial. So natural can be when we get exposed to microbes. Then our body develops antibodies, natural antibodies. So that is natural. And artificial would be, again, vaccination. And both can be passive and active. Okay? So this is kind of like a synopsis of what immunity can look like. Now let us see what Ayurveda talks about as far as immunity is concerned. And I have kept some of the original Sanskrit terms because this is really important, because we can try and correlate the terms with their meanings, but they are not exact. So we should try and understand or at least keep in mind the original Sanskrit term. So the first one is the concept of Vyadhi Kshamatva. Just like Ayurveda is a complex Sanskrit word, Ayu and Veda, right? All of you know about this. So Vyadhi Kshamatva is again two words. Vyadhi is disease and Kshamatva is the capacity. So capacity for disease prevention as well as disease protection, both. Okay? So when our immune system is in its optimal status, it will keep us protected from vyadhis, but will also make sure that we are, again, this is about the balance, that we are also tolerating some of the things that we need to coexist with. Ojas is the subtle essence of vitality in our body. It is considered to be the essence of all the 7 dhatus. So think about Ojas as the vital force in our body. So we say that when your immunity is low, your Ojas could also be low. And this is something you cannot measure in a lab. So these are the concepts that are really important in Ayurveda, that by your aura, by your look, you know. So in our spoken conversation, we do often use this. We say, you don't look well. Have you heard this? So what are we reading there? We are not doing any lab test there, right? We are actually looking at the person and their energy. How does it feel like, you know? How is the aura? How is the reflection? How is the glow? What is the color of the skin? So we may not be doctors, but we are looking at that. We are sensitive to that. So we might end up asking, you don't look very well. Are you all right? So that is a reflection of Ojas. This is not a biomarker that you can measure in a lab test. I'm just trying to make sure I don't fall from here. Agni. I think one of the very, very most important concept in Ayurveda is the most important concept is the concept of Agni. So Agni, I would like you to understand it as like the solar system has the sun at its center, correct? Sun is bright and alive. Planets, there could be life, right? We know Earth has life. We don't know about other planets. But let's say sun is essential for life, yes or no, at least on planet Earth. Agni is our own personal sun. It is right in the middle. If I am the planetary system, my sun is my Agni. Okay, think about that. There is a yellow, bright, warm sun at the center of your being. It's in your belly, right? This is the concept of Agni in Ayurveda. And Agni is something that is our friend, but it can also be our foe, right? When fire is in control, it does great things for us in the universe. We can cook with it. We can heat our spaces with it. Thermodynamic principle, right? Thermal principle, very important in the universe, has so many applications. But the same fire, when it is out of control, it destroys. So it needs to be in the correct measure, right? So Agni is an extremely important concept. It not only cooks for us, because cooking is something that happens again in our body, not just outside in the kitchen, right? When we are eating an apple, it is cooked again inside our body, yes? Yeah? Because it has to become muscle tissue. It has to become blood tissue. It has to become our skin. So second stage of cooking depends on this. And if this cooking is suboptimal, there is leftover residual material that is toxic to the body, what we call ama. So Agni in Ayurveda is like the very central principle. It can also burn germs. Burn means not literally. It's just a visualization. Just like here, fire can burn mosquitoes or flies or whatever you want to put in it that are troubling you. Similarly, when our body is exposed to microbes or anything that the body is not going to do well with, our Agni will destroy it. But it has to have that buddhi, the intelligence. And that intelligence comes only when we take care of the Agni. If we are not taking care of the Agni, then this affects the immunity, directly proportional. Low Agni, low immunity is a given. So we'll remember that. Dhatu bala, tissue strength. People who are emaciated. So how, in Ayurveda, we have the concept of 7 dhatus or 7 tissues, which pretty much cover all the tissues in our body from modern perspective as well, right? Rasa, Rakta, Mamsa, Meda, Asti, Macha, Shukra. Okay, all reproductive, everything is included in that. So we should have optimal dhatu bala, optimal tissue health. If you are emaciated, if you are undernourished, if you are depleted, that will also directly impact the immunity. Preventive regimens like dinacharya, daily self-care, rutucharya, seasonal care, sadvritta. Dinacharya, rutucharya, you probably understand, okay, yeah, our daily care, we have to put some oil here and there and take care of our eyes and other organs. Rutucharya, seasonal alignment. Sadvritta, what is that? Sadvritta is the preventative, promotive practices for mind, spirit, right? Our emotional well-being. So often we are taking care of the physical body. We are not taking care of the mental, emotional body. So we are still feeling off. Doctor is saying you're fine, your BMI is perfect, your cholesterol is perfect, everything is fine. But this health, mental, emotional health is not good. It's depleted. It's not optimal. Then also immunity is impacted, and we are learning that. Stress directly impacts immunity. Stress directly impacts microbiota. Okay? Next is promotive regimens, which is a very unique concept in Ayurveda. What is promotive practices? It's very simple. I'm trying to just make it like very conversational so that everybody can understand, even if you're not from Ayurveda. Promotion basically means if we are born with X amount of health, prevention is maintaining X amount of health. Promotion is, can we make it X plus 1? Can we make it X plus 2? Can we make it 2 times X? That is promotion. And this you must understand in the language of tonics. I'm taking a tonic. I'm taking a brain tonic. I'm taking a heart tonic. That is positive health. So this is the concept of promotion in Ayurveda, which is very unique. I won't be able to cover all the slides, but I want to make sure we have this conversation. So these are the tenets of immunity, 13 fires. We have the concept of 13 fires and 3 pillars of health. Ahara, Nidra, Brahmacharya. If you can take away just this. Food, pay attention to your food. Second is sleep. 5,000 years ago, same value, same importance as food. Don't just pay attention to food and think, I can stay up late till 12 o'clock and I will get up and go to my morning run at 5 a.m. That's why maybe, possibly, a lot of people are falling dead in the gyms because they are not sleeping enough. So 5,000 years ago, Ayurveda has said sleep is as important as food. Third is brahmacharya, which is often falsely or wrongly translated as celibacy. I would call it life's discipline. Little bit of regimen and discipline. Brahmacharya. That is what brahmacharya. So if you remember just 3 things, little bit of regularity in your day, proper food and proper times and proper portions of the food, and sleep, please sleep. I tell this to all my clients, get sufficient sleep. Don't run, don't be in a hurry to get to your goals in life because you will not reach there. You will not be there to reach there. So sleep, I want to underscore that, bold that, highlight that for everybody. Please take that away with you. And then bala, the concept of bala is also very important. Innate, you see the same terminology here now. Innate, temporal, by timeline, your biological, your chronological timeline and biological timeline. What you acquire is temporal. And then acquired, that is the promotion concept. You can acquire positive health. My time is almost up, but I want to leave you with this. Buddhi, ojas, if you take care and take care of your channels. So Ayurveda has this very important concept of channels, millions of channels in our body. Flow is health, blockage is disease. Just remember this. Flow is health. All your channels should be flowing, and blockage is disease. So I'll leave you with that. Thank you.
I'll try to remote control. Here? Yes. Thank you so much for your inspiring presentation. It is our great honor to welcome Dr. Venkata Narayana Joshi, renowned Ayurveda professional globally recognized for his outstanding contributions to Ayurveda education, postgraduate programs, workshops on food as medicine and gut health across Europe, and for advancing Ayush initiatives and traditional supplements worldwide. Please welcome.
Thank you. First of all, my heartfelt congratulations and thankfulness to wonderful organizations being in this environment, Dr. Thomas and all his team. Thank you one and all. And this is the time for the integration at the global level into the oneness, because we are all one. Irrespective of ethnical variations, cultural diversities, our ages, gender differentiations, we are all humans into the oneness to bring homeostasis, harmonious health, as a means of wisdom coming through from the time immemorial. And we have to re-bridge it from the past, present, into the future. This is the knowledge which is flowing unabated into the many, many time immemorial millennia. So that truth we have to unfold and bring to the evidence into the contemporary wisdom of practice. That is what the global integration of our ancient wisdom is all about. One nation, one health, one earth, one health. All these slogans from India, Prime Minister Modi, taking into the United Nations, from the yoga and Ayurveda, and so on, into the preventative aspects of much more needed healthcare integration into the current practices. Talk about non-communicable diseases, lifestyle disorders, mental health conditions, chronic ailments, and Alzheimer's, autoimmune disorders, and so many areas where this wisdom can perfectly give and blend and run and integrate into the harmony for bringing optimization of the health, what it is needed, into the futuristic level of integration model of healthcare. So if you see from the conventional point of view, non-conventional point of view, historic point of view, ancient to the modern contemporary, these two lines, which are something like two tracks, parallel lines. And the health track, health train, has required these two to run on for a smooth journey of our lifetime into the integration. And time to time, we have junctions where we unite and exchange without losing our own values. We integrate for the wellness as the direction of the journey of our life is being succeeded for the perfection of this integration. So, for example, there is a lot, and how we integrate, how we understand our oneness of the health and oneness of being. See, we are all with these wonderful hearts. When the hearts flow with the community into the joyousness of the oneness, and the tears roll down from the eyes, the joyful tears and the sorrowful tears as well. So when the heart is heavy, when the tears come out, heart becomes light. And this is what a physical, emotional wellness is being reinstated. So be into the unity of integrating by just laughing, sharing, caring. And that way, the heart becomes lighter because the tears roll down. This is the physical evidence. Everyone will have these tears. Enjoy to the part of the tears to get rid of the miseries, sorrow, heaviness, and you become light. You share. So this is the subjective flow of from where? The heart into the connectivity of the brain and then to the whole body, the sequence. The sequence is physical body into the physiology from the sensory point of view into the connectivity of the mind and ultimately into the spiritual wellness and well-being. So this is the process of integration. We have to cultivate and develop. When we make a mistake, we just, oh my God, we touch your head because it is wrongly projected from here. I'm right here. I know what it is saying inside me. And every conscious heart has this feeling about the righteousness, judgmental. And this we have to hear to our hearts. We are not. And we are just tricky minds we are following. That's the reason we are doing all commits. And this is the way the integration from the subjective level of the quality enhancement into the practices for building the evidences. The evidences are in dualistic perspectives from the point of view, practice-based evidences to the evidence-based medicine. And how this contemporary evidence is being brought from the dual levels of Ayurveda's perspectives in generality, similarity, equilibrium, oneness. So the equation is always proving to be a growing factor. We are all humans into the part of wellness. So, for example, a simple means of life, sustaining from the water. The water is the source for every life. Anybody? And this water has an enormous applications for the wellness. That we have to understand. This is an integration. What does it mean? The water sources from Ayurveda point of view, when you look from the pure zero memory of this wonderful rain water continuously pouring down hours together later, and that is where you start boiling it, and self-reducing the water to the half a quarter level itself is well-assimilating quality enhances by the water. What not when you have these crystals for health, and then the marble stones, and the minerals, and the plants, herbs, spices, when it is being, we have these wonderful teas. So it's a water-based therapies as a model in Ayurveda is a wellness into the increasing by simple means of different type of the honey. We have a different sources of honey, a wonderful floral, organic forest honeys. And just a simple, believe me, the water, honey, water dilutions. And what is the technique over here, implementation? Integration is to bring into the saturation on the early morning when you have a organic cold-pressed honey, mixed, diluted into the water and just drink it, to the point of optimization in yourself of the stomach filling capacity. Individually we have. Constitutional variations are there. The oneness into the treatment protocols of the standards are being, what is my stomach capacity makes me nauseating. That's the point of your filling honey water as a means of detox. If you do, and then when you are starving, hungry to have this alkaline food, and maintain this the whole day, Ayurveda's protocols of this minimum 3 days to the maximum 7 days, not to habituate to the kind of the mesmerizing, immunomodulating supplementation, simple honey water. And you see the results. This is what the metabolic boosters and restoratives, simple from the water to the honey and extension to the many edible substances into the kitchen areas, and we can restore back our health. So we have to have this oneness of this global health to be brought into the wisdom. By, you can see like Bhagavad Gita, and you have Bible, you have Quran, and these sayings. What does it say about the health? Why, what the Lord Krishna said about it? Ayuhu, Sattvaha, Balam, Arogyam, Sukham, Preeti. Now you understand 17th chapter about it, isn't it? That is what the sattvic ahara, wonderful food what we enjoyed in these 3 days is that kind of the invigorating, energizing, rejuvenating. So it's the preventative aspects of this health promotion to the sustentation and then to the longevity and then to the rejuvenation and longevity. These are all obtained, whether it is from the lifestyle mediations or the food as medicine source mediations, and then to the, as the previous doctor said about this mental health. This mental health is the biggest problem, a challenge now. And how Ayurveda looked into the mental health. into the extension of giving guidelines on the counselings, 9 aspects of the mental negativities which are being explained. And you see, if you just start about this one lobha, for example, in Sanskrit, what does it mean? Everybody today, we are after the busy lifestyle and schedules. We are not satisfied what we are earning and living. We need more and more because we start comparing others. You have a Ferrari, I would like to have it. You are a successful businessman, I would like to have a millionaire. That's for sure. I mean, like, having desires is not bad. But then suffering through the process of trouble, stretching your feet beyond carpets. How many people are living on debit cards and credit cards? Financial carriage, so many people are committing suicides because they cannot maintain, they cannot come down the lifestyle what they are desiring for it. When I don't deserve, I desire more. That's the problem. This is the mental negativity, what it is there, because we are after the physical values. Everybody has to have what is the comfort we need, isn't it? A good shelter, good food, and then a good environment and a happy life and a happy family. From the self-center to my family and to the community, that is where the spreading of this wisdom, what it comes through from my heart and spreading onto my mind, and then extensively into my 1.3 trillion cells. That's what the microbial world of our harmony is being restored back. So it is simplified as a metaphor to say, as the previous doctor said about the sun. If you want to say what is sattva, it's my mind as a quality from Ayurveda. What is sun? Can you explain the sun? It's a self-luminary body which is controlling not just only earth and its whole entire environment, by ozone to the infiltration, to the useful radiation, to the warmthness, and then when it comes to the plant life of this source of food is being generated out. That is the wisdom, what we are every day seeing. Why can't we be surrendered to this wonderful sun, what it is there within me, and it is what explained in Sanskrit. Hrudayam chapyam pundarikam hrudayas cha jadumukam atonishya vitasyante. There's a lot of descriptions are there. What is this sparkling? It's sparkling in the fully heart. Say the plasmatic, lymphatic, the essence which is being flowing, the biological fluids in my heart, and it's being pleased or content. Otherwise, my what happens? My skin gets dry, or my ears getting tinnitus, my heart getting palpitations, and I'm not strong. So these are the signs which will come out when the heart is not happy. So make it that hrudya is like empowering your heart with the substances, simple substances. For example, Indian gooseberry. You might be knowing about Amalaki Indian gooseberry. It's not the gooseberry what it is in the Western. And this Indian gooseberry with the 6 segments of this wonderful supplement, when you just put it into the honey and soak it well to consume every day, and it is having the all 6 tastes present in it. That is except the salt within it, because salt is just a universally acceptable as a, what you call like in the metabolic boosting, it is like a spectator. It's not involved into the biological process of these exchanges. And this fruit into the hrudya is the biggest rejuvenation. What does it mean? Like chronological age, biological age, in contrast to my growth and development of all my systems. What Ayurveda says about vaya sthapanam, amalaki vaya sthapaniyānām shreshtam. That's it, that one quotation. Then we have to apply this into the integration and testimony, and then successfully evidence is being built through the practice-based evidences only into the individualized chronic ailments, suffering, irreversible conditions, autoimmune disorders. But then to the evidence-based medicine is into the generality of the people, commonality, considering into their digestive phases, to the mental health or whatever it is being restored back. So it is through the counseling, it is through the lifestyle, it is through the diet as medicine, food as medicine. There's a lot to support. So Indian gooseberry, which brings the pleasing quality to the heart and circulation, that way your mind is much happy. So like the sun, when it is reflected and controlled by the ozone, and say, for example, this light and wisdom, warmthness is being spread out onto a nearby swimming pool, and this glittering, shining sun in the waters is being reflected onto the wall. And what is the reality? Can you see the water reflecting water on the wall is reality? Or the sun reflecting, glazing onto the water is reality? Or looking back into the source of the sun is reality? So the sun in the heart and the brain reflecting, this is empty screen. And just it reflects everything when the sun is reflecting onto my mind. 86,000 possibilities is explained for this mind to illuminate from your heart. So pure in the heart, honesty, by heart, when I said I put my hand on my heart, I promise. So you promise yourselves to get into the experience of this mental wellness, and that is the flow Ayurveda gives from all aspects of this health into the integration. So there is a lot to talk about, but it is not into the mind for sattva, how to enhance. And then because it is the chip, it's microchip and supracosmic elemental contributions in our sensory brain. And that reflects as a multi-millions of mirrors when you put the sun reflecting into all. So every cell is a reflection from this source. When you are fully potentially from heart to the brain into the every cell, then harmony restores, self-healing starts, and that is where the integration is. So we have so much to offer from the point of view. There is no time, but you can just read about these slides every time is available. But in fourfold verification of the knowledge, the process is there, and the integration models are there. Everything, thanks for the WHO and India in collaborations to bring this wonderful science of the ancient wisdom to integrate into the futuristic model of oneness, into the one globe and one health, one identity, one human beings, no borders. Thank you, one and all. Thank you.
Thank you so much for your inspiring presentation. Now it is my great honor to introduce Professor Bishnu Prasad Sarma, distinguished Ayurveda physician, award-winning researcher, and former principal and dean of Government Ayurvedic College, a visionary leader bringing Ayurveda to the people. Professor Sarma could not join us today and will therefore kindly share his pre-recorded presentation with us.
Namaskar. Good morning to everybody, respected distinguished guests and speaker, ladies and gentlemen. Myself, Professor Dr. Bishnu Prasad Sarma from India. Today I will speak on Boisarna Surna and Boitorna Basti for the management of rheumatoid arthritis. Ambata is a disease caused by Dusti of Rasabaha Srotas, in which there is a formation of ama due to Jatharagni Manda. Ambata disease was first described in Logutrai by Asajya Madhava. Ambata develops due to Dusti or Prokopa of ama as well as Vata dosa. The vitiated, under-metabolized, digested material enters the main circulation along with the vitiated dosa, creating cledor, inflammatory secretion, and heaviness in various parts of the body, leading to heaviness and weakness in the hiridoid. Hence, this combination of aggravated vata and ama, when lodged in the various joints of the body, creating stiffness, eventually pain, is called ama vata. Etiological factors and pathogenesis, dietary cause, then lifestyle, then psychological. Negative mental state while taking meals. Stress is a triggering factor for Ambata. Symptoms, Lakshana. Ambata presents itself as causing discomfort, pain in various parts of the body, loss of appetite, frequent thirst, generalized laziness, heaviness in the body, mild grade fever, improper digestion of food, consumed, as well as localized swelling in various parts of the body are some among common symptoms. Clinical characteristic of Ambata: Hasta Sandhi, Sotho and Sula, Pada Sandhi, Sotho and Sula, Janugulfa Sandhi, Sotha, Anga Gaurava, Stabdhata, Jadya, Anga Boikolya, Sankosa, Bikunsana, Anga Mata. Chikitsa Sutra. As far as the Ayurveda, Chikitsa Kram is Apatarpan, Langhan, Sodhan, Saman, Sedan, Rasayan, Patha, Ahar, Bihar. Rheumatoid arthritis is a chronic inflammatory disease of connective tissues which principally affect the joints and may lead to permanent deformity and chronic invalidity. Systemic manifestations are common, and this may lead to term rheumatoid disease, being used to emphasize their widespread nature. Rheumatoid arthritis is common in all parts of the world, although most severe form of disease seems to be found most frequently in the northern Europe. Prevalence, approx 1% of the population is affected. Indian data suggests prevalence to be around 0.65% to 0.75% of the population. Sex, the disease occurs in both sex, but the incidence in women is greater than men. In general, female-male ratio is 3:1. Main clinical features: onset is usually gradual between the ages of 20 to 50, with symptoms of joint arthralgia in one or more joints. Classically, there is swelling, heat, and pain. The pain and swelling causes stiffness, which is particularly evident first thing in the morning. 10 to 15% onset is acute, accompanied by systemic features, particularly weight loss, irritability, depression, and malaria. A clinical study was done at Government Ayurvedic College and Hospital on 60 cases were selected randomly, regardless their age, sex, and socioeconomic consideration. To study the efficacy of Boisarna Surna along with Boitorna Basti in the management of arthritis. Inclusion criteria: clinical history, examination of patient according to Ayurvedic and modern methodology, laboratory investigation. Exclusion: age below the 10 years and above 70 years, hypertensive, the patient having long-standing complication, pregnant. Trial drug: Boitorna Surna and Boitorna Basti. Form of trial drug: Surna form. Dose 6 grams twice daily after meal with warm water, and the total of 12 grams was given per day orally for a period of 90 days. Procedure of Boitorna Basti and Matra Basti is only till-tail was given every alternate days for 8 days. Along with the Basti, the same time Boitorna Surna was also given and continued for 90 days. Criteria for assessment of the result: degree of remission and sign and symptoms, reduction of inflammatory index, changes in EF. Composition of Boitorna Surna: Sandhavlavan, Azomoda, Ajwain, Sunthi, Haritati. This compound mixture is made into powder form and mixed together for internal use. These are the Haritati, Ajwain, Sandhavlavan, the drug chosen for the clinical. Then Boitorna Basti, Gomutra, Imli, Guru, Til-Tel, Sandhavlavan, and Madhu are used. This is cow urine we use, tamarind we use, jaggery we use, honey we use. These are the instruments we use to give Boitona Bosti. So Onubasan Bosti Tiltail was used. Dose of Tiltail is 50 ml. Boitona Bosti is ml. This is the procedure. First day we give Tiltail. Next day we give Boitona Bosti 250 ml. Total duration treatment was 11 days, which included mild Longhorn Virasana for 3 days and Yoga Bosti for 8 days. Patients were kept on mild Longhorn for the 3 days. During this period, they were advised to take light diet. Complete fasting was avoided as it aggravated the Vata dosa. Observation and result. In our study, 9 patients was male, 51 patient was effect of rheumatoid, effect of treatment of pain observed in 60 patient rheumatoid arthritis. Before 2.13, then after treatment it comes to 1.30. In case of swelling, the swelling has also comes down 1.63 to 0.3. In case of stiffness also comes down from 1.7 to 0.93. ESR also comes down from 76 to 50. The showing the effect of treatment in terms of complete remission, moderate remission, and onset. Complete remission is 25%, moderate 61.60%, and onset is 13.30%. And this is the before and after treatment. You see, before treatment, patient is unable to close his finger, but after giving treatment, patient can easily close his or her finger. So some albums after giving treatment, patient feels well-being. At OPD, patient can easily fold their hand. So rheumatoid arthritis is a form of chronic immunoinflammatory systemic disease, which can be correlated to Ambato in Ayurvedic parlance. Boisana Surna, along with Boitona Bosti, showed its effectiveness in controlling pain, tenderness, swelling, and stiffness. Boisana Surna has good anti-inflammatory and digestive property. Boitona Bosti helps in eliminating vitiated Bato and Ama. Gomutra used here have antioxidant properties and good immune enhancer. Cow's urine has also been found to have bio-enhancing properties. During the course of treatment, no side effect and adverse reaction were noticed. These are the photos of Kamakya, Bihudens of Assam, India. This is waterfalls at Meghalaya. Thank you. Namaskar. Jai Hind.
Thank you to Professor Sarma for his inspiring presentation. Ladies and gentlemen, we have now reached the very end of the speaker sessions. Let me sincerely invite you to the closing ceremony scheduled for 15:35 to be broadcasted online from the hall number 1. On behalf of the organizers, let me sincerely thank all participants who made these days so enriching and inspiring. We wish you every success and look forward to meeting you again at the future gatherings. Thank you very much and all the best to you.